2, 1.
I hereby declare the Candido County Board of Commissioners is now in session. Will you all please stand as we say the Pledge of Allegiance to our flag? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good morning, everyone, and good morning to all those individuals who may be live streaming this meeting or watching it later on YouTube. For the record, today is Tuesday, October 18th, 2022. On our agenda, our first item is the consent agenda, and there's 3 items. We have the minutes from the last meeting, the auditor's warrants, and the approval of the human service warrants and claims. Commissioners, does anyone wish to pull any of those items or have any quick questions? Otherwise, I'll entertain a motion.
Also move that we adopt the consent agenda.
A motion by Commissioner Nissen to adopt the consent agenda. Is there a second?
I'll second that, Mr.
A
Chair.
second by Commissioner Amdek. Any further questions or comments? Hearing none, I'll call for the vote. All in favor, say aye.
Aye.
Opposed, same sign. Passed unanimously. Next, I'd like to call on Candido County Human Resource Director, Connie Moore. Good morning, Connie.
Good morning, Connie.
Morning,
Good morning.
members of the board. I come before you today with an employment agreement between the County of Candy, Ojai, and Kelsey Baker, who is our candidate for County Administrator. I have before me a executed employment agreement signed by Ms. Baker for your approval. This agreement has been negotiated by the negotiation committee consisting of Commissioner Berg, Commissioner Gardner, and myself. The employment agreement, the employer agrees to employ the employees as county administrator. They shall pay the employee a salary of $138,250 per year, and the official start date of employment will be February 15th of 2023. Any other questions or comments?
Just a curiosity,
Commissioner Nissen, yes.
were you going to hang around and coach her for a while, or is that off the table since she's not starting till February 15th? I just wanted to.
Yeah, I can, okay. The committee met, and what the committee came up with is this is the best option we could come up with in the negotiations. And there will be an overlap from the 15th through the 24th. But Ms. Baker also is going to, on her own time, try to figure some days to be able, or hours to stop by and come in prior to that. And we figure we have almost 4 months to work on that, and that Mr. Kleindahl and Ms. Baker could pursue
All right.
that.
That wasn't part of the negotiations.
Yes, no, it's very important part of the negotiations. Commissioner Gardner.
Thank you, Mr. Chair. Also, one of the reasons for the what seems like a delay in implementation is that both counties have projects that they need to see through to some completion, and so this is the time period that makes the most sense for both entities. Also gives Swift County, I think, time for themselves to start going through their process of hiring a new administrator as well. So I would characterize the negotiations as pretty routine, and we're looking forward to moving forward.
Thank you, Commissioner Gardner. Also, for the public and everybody's information too, the contract is online on the county website and is available for people to look at. Any other questions or comments? Otherwise, I entertain a motion to approve Kelsey Baker.
I will make that motion, Mr.
A
Chair.
motion by Commissioner Gardner. Is there a second?
I'll second that.
A second by Commissioner Anderson. Any further comments or questions? Well, hearing none, I'll then call for the vote. All in favor, say aye.
Aye.
And opposed, same sign. I'm very proud to say and excited to say that on a unanimous vote, our next Candido County Administrator, taking effect on October 15th, 2020.
February.
February 15th. Thank you. I'm very excited about her taking effect as a new county administrator on that date. I also like to thank her and also thank all the candidates that applied for this, as well as our staff time and the commissioner's time. This is a very lengthy process to get to this point, and this is a very exciting time that we are here and we're moving forward. And now we can focus on the many other challenges we have. So thank you. Any further comments at this point? And thank you, Ms. Mark.
Thank you. Commissioner Berg, I would like to approach with the contract for your signature.
Yes,
as
please.
well as the vice chair.
Please do. Either way. Okay, there we go.
Go ahead and call the next one. You can go ahead and call them. Oh, the next one.
Well,
I haven't done this in a long time. Get practiced.
Yeah.
Only a few months left for next year.
next on our agenda, we are going to be having an update from Woodland Centers, and I'm looking forward to hearing that. And I would like to welcome Dr. Ashley Trost. Good morning.
Good morning.
Good morning. Good morning, everybody. Thank you so much for having me here. I like to come every year and just talk about Woodland Centers, what we've been doing, where we're headed, and answer any questions you have. So I did send some information, just some packet of data and just an overview of kind of where we've been. So I can run through some of that. And of course, any questions you have along the way, don't hesitate to stop me because I talk kind of fast. So last year, 2021, we served 4,646 clients across our 7-county area. 87% of those clients were from our 7-county area. We do serve folks across the entire state. Actually, we serve people from 59 counties in the state of Minnesota, and we actually serve some residents from out of state as well. Sometimes it's coming into our crisis center or accessing mobile crisis, or they might be living in our county, but their county of responsibility is somewhere else. So there's a lot of reasons for that, but the majority of folks that we see are living and residing in county residents of our 7 counties. We have a $15 million budget at Woodland Centers for 2021. In 2022, we're projecting a $20 million budget. So it's a pretty significant increase just because of our CCBHC status. We moved to a different payment model, a different service delivery model in 2022, and it really has impacted everything we do, mostly in a positive way. I think our staff are struggling to just make all the changes. But overall, it's a lot of really positive change and continue to make changes as we move through. And I can talk more about CCBHC down the road, but it really impacted our budget in a significant way. When we talk about income, the majority of our income does come from service revenue. So we deliver a service, we bill insurance. That's about 65% of our total income and our revenue. About 18% are our county contracts for 2021. In 2022, we are seeing a shift in that because of how much we are billing other providers. And so in 2022, our POS contracts are around 12 to 14% of our overall revenue. So as we increase our services and continue to grow, those contracts continue to be less and less of our overall revenue, percentage of our overall revenue. When we look at some of the other data here, I wanted to show you our client services delivered by modality. So as you can see in 2019, 99% of our services were delivered face-to-face. And then, of course, COVID happened and our whole world changed for everybody. So in 2020, about 40% of our services were face-to-face. 14% being over the phone and 46% by telemed. Of course, at one point it was 100% services telemed, and then we slowly shifted back to other modalities. As you can see in 2021, in the first 6 months of 2022, we are shifting back to more face-to-face services. But I predict we will never completely go away from telehealth. That's here to stay. It's a really beautiful thing when we have our Minnesota snow days. We could still deliver services. Prior to 2019, if we had a snow day, it was kind of, we're not delivering service because nobody's on the road, we can't see people. But now we have that availability and we have that option. So if there's 2 days, 3 days sometimes where we can't get out on the roads, we can still see our clients, we can still deliver care. So that's a really big deal for us and for our clients that we serve. The next area down there is the comprehensive evaluations and same-day access. In 2020, December of 2020, we implemented same-day access. So what this means is that if you call and you're new to Woodland Centers, you need mental health services, you call today, we will get you in for that evaluation today. So we are not scheduling those appointments out. Previous to this date, what was happening is you would call and say, you know what, I need to have mental health services. We'd say, great, we have an appointment for you 2, 3, 4, 5, 6 weeks out. So 3, 4, 5, 6 weeks out, what would happen is 27 to 28% of our clients would say, you know what, I don't need that appointment. I got my appointment somewhere else. I'm feeling better. So our no-show rate was huge. And it's not delivering great care because if you need the service, you need the service today. So we really wanted to change that. So what we have done starting again at the end of 2020 was we implemented this same-day access model. Now there were bugs, there were kinks, there were things we had to work out. At this time today, we have 5 FTE and their full dedication is to same-day access. When we implemented this model, we thought we would need 8 to 9 diagnostic assessment or evaluation spots per day. COVID taught us very quickly. We are needing between 15 to 20 a day. And so that was part of the hiccup is we just did not have enough people doing these to keep up with the demand. We now do. So we are doing between 15 to 20 a day, sometimes 23 to 24 a day, depending on the day. But as you can see here, the number went up significantly in 2022. We are doing 82% increase in the number of assessments that we're doing, and our no-show rate went down by 55%. So it feels pretty effective for us. Even same day, if you call in today, we're still having a 10% no-show, 11, 12% no-show rate. I'm not sure how to totally eliminate that, but it's significantly reduced. So we're pretty happy with those results.
Commissioner Gardner, some questions, please?
Yes,
May I interrupt you?
please.
Please proceed.
Thank you, Mr. Chair. Dr. Yost, just to piggyback on that, what are there barriers for the patients that might cause that, such as transportation?
So all of these appointments are via Zoom. I shouldn't say all, the majority. I would say 95% are via Zoom because the 5 FTE we have actually don't live in the state. We have a half an FTE that lives here. So they are all over the country so all of these are happening Zoom. So if you don't have access to internet or a device at home, you can come into our offices and we'll set you up. So it shouldn't be a transportation issue, but that can be. It can be a barrier. So we do work with folks. If somebody says, you know what, I have to get to your office, I have to set up transportation, and we know if it's somebody that has to use MA or some of those like volunteer drivers, it's 2 or 3 days to get that set up. So we will make exceptions if we need to. Sometimes it's also an exception when parents have to take work off. And so we will sometimes make that exception. If it's for a child appointment and we need to set it up a day or 2 in advance, we can make exceptions here or there, but 90% of the time it's working for folks. The no-show rate, I can't quite put my finger on why, because it might be even, they call in at 8 and the appointment's at 11 and they're not there. We don't ever hear from them again. So it's hard to know why.
Okay, thank you.
Yeah.
I just would like to add, I would think a lot of businesses have a big problem with no-show rates anyway, so there's probably only possible to get 100%. It's
Yes.
impossible to get 100%. One of the questions I had when you talked about same-day appointments, that is really fantastic news. That's something I think everybody's hoped for, right?
Yes.
Way things are nowadays, and for mental health services to be that available in our community, that is just great. Have you seen any correlation by same-day appointments as to admissions on crisis? If they didn't get that appointment for several days, would they end up in crisis otherwise, possibly?
It's likely. I think it can be very likely. So what we also do is when we have that first phone call with a client, we screen. We do a suicide risk screening. And if that comes out orange or red, it's based on numbers, we do refer them to our crisis unit at that time. So even if they're saying, you know what, I can't come in for an assessment today, we're like, we think you're in a spot where we'd like to have somebody see you, and those assessments can also happen via Zoom. So if that person can't come in, and those assessments can be pretty quick, just to even get them connected with our mobile crisis team and get somebody to see them until they can get in for that comp eval. So we're trying to even put in some of those buffers in between when we know somebody is at risk, and maybe today doesn't work for them to get that comp eval. But yes, I think that delay, that previous delay of I call, I'm waiting 3, 6, 7, 8 weeks, right? That's problematic. People are ending up in crisis. They're ending up in ERs. They're ending up in the hospital because their symptoms are so severe. And we also know, just based on research, that people wait 8 to 10 years before they ever make that first phone call. So they've had symptoms, most likely, for 8 to 10 years. And now they're calling us and they need service. They're willing to access that service. And now we're saying, sorry, it's another 8 weeks. Unacceptable, right? And so we're really trying to make sure we're available at that point of contact.
With all these Zoom meetings, are they still billable? Any
Yes.
issues with that?
Yep, we have not had any issues so far. The telephone is up for debate. I think at DHS they were studying that until 2023 or 2024. I can't remember the exact year. But they were going to do some more studying on that and see what they could do. So that's still a billable service through that time at least. If they don't extend it, that would sunset the telephone billing, but telehealth is here to stay.
Good, good news.
Yes, yes. Any other?
Any
Okay.
other questions?
I do have a question, but
Commissioner
I'll
Beck.
let you finish your presentation and then I'll ask.
Okay, absolutely. So 2021, again, we implemented the same-day access. We were awarded a 3-year Prime West Health Equity Grant. We were the largest awardee in the state. We received $250,000 to do health equity work across Woodland Centers. The work actually started here in 2023. It's been a really big project. I know my board members, we've talked about it quite a few times, but it's a really exciting thing to be able to talk about how can we increase the equity and the inclusion, not only from our staff side, but also from our client side. We know, especially here in Candido County, there's a big population that we are not serving, not because there's not mental health and substance use needs, but because we need to do a better job of being inclusive to those populations. So more work to come on that. It's a really exciting thing we can do. Again, opportunities to do hybrid work. This has helped with our staffing and being able to maintain staff to just allow people to work from home. We had a clinician that moved to the metro during COVID and she could stay on as an employee. So it's offered us some opportunities there where in the past we couldn't keep people. And then 2021 was really major on just planning and preparing for CCBHC. It's just a huge undertaking. So in 2022, we obtained that certification January 1. And we've told our staff, we've told all of our service partners, this is going to change everything about how we do everything. And it really has. It took our diagnostic assessment and turned it into a comprehensive assessment. And it really is looking at the whole person. So previously, we would do a mental health assessment and we would really focus on their mental health and substance use needs. And now we're looking at that whole individual because we know we can't just treat the mental health. We have to treat their physical health. We have to treat their social determinants of health. If you don't have housing or you don't have food to eat, we can throw depression care at you all day long and it's not going to get better. So how can we make sure we're giving you referrals, giving you recommendations, getting you the treatment that you need, partnering with our community partners? So if they have a targeted case manager, how are we communicating better and making sure we're all on the same page, working towards the same goal for our clients? That's our goal. I don't know if we're quite all there yet. It just takes time to change all of these systems internally for us. But I think we're moving along that path of that integrated, coordinated care for our clients. So that's been huge. And then in the last year, we've also increased our substance use services exponentially. We now have an adolescent substance use program here in Willmar that started in January, and it has been full since we've opened, continuing to get referrals. We are now looking at partnering with Prairie Lakes. They are bringing youth over from their group homes, but they also are asking for a program in their locked residential units, which is a whole nother undertaking that we are considering and looking into for them, because we know there's a need there. We are also a medication-assisted treatment provider, which really means if somebody has an opiate use disorder, alcohol use disorder, tobacco use disorder, we can offer medication to help people get through that addiction and hopefully not use substances. And so we can help really get people off of those drugs. which is a huge supplement to both our substance use team, but also our psychiatry team. We are also a naloxone access site. This was about 3 to 4 months ago. And so what that means is that anybody in our communities can come to a Woodland Centers office and access naloxone. We will give you a kit, and we will offer you training on that. There is a code that you can use, and you can have training on how to administer naloxone. And this is really a life-saving drug for if somebody is overdosed on opiates. So far, and this was an old number from probably about a month ago, we have distributed over 100 kits, and that is 300 doses. So that's potentially 300 lives saved. And our hope with that is that it starts with saving a life through naloxone and goes into treatment, and we can help get those people into treatment. So it's a really exciting opportunity. There are no naloxone access sites in our region at all. And so we were the first to really pilot this in our area. So we're very excited to be able to do that. And then 2023, we just submitted the grant. We are going to be offering school-linked behavioral health services. So right now we have school-linked mental health, which means we have therapists and practitioners in 13 different school districts, about 40-some buildings across our 7-county area. This will allow us to put licensed alcohol drug counselors in 5 different buildings across our region. And really the goal with this is early intervention and prevention. How can we educate people? How can we talk to these students and help them understand the risks and the dangers? Because right now the reality is if you smoke a joint, it's probably not just weed. There is likely fentanyl in there, and you could overdose very easily. And I think helping kids understand that when you take a street drug, you don't know what's in that, and you have to be really, really careful. Because you could overdose very, very easily. And I don't think everybody understands that. And so we're going to start with middle school, we're going to start with high school. Again, that early intervention, prevention, and if we're finding somebody that needs treatment, we can then make those referrals and get them into treatment quicker, and hopefully preventing these youth from having hard lives as adults. So that's our goal. So that should be coming in 2023. Like I said, we just submitted the grant proposal to DHS. Hopefully we'll be hearing soon. But we feel like we're in pretty good position because of our schooling grant. So more to come on that. We also started offering services at the Kaneohe County Jail in January, and this has been a huge project for us. It's really exciting to be able to be in there. So we have a clinician at the jail. It's been 8 hours. We just bumped it up to 12 hours because we saw a greater need. We have clinicians on call in the evenings and weekends for when somebody is on suicide watch at the jail. And then we have a care coordinator and a mental health skills worker in there to be able to help coordinate when somebody is being released. How can we get them into mental health services to hopefully stop that revolving door effect, or else substance use treatment services. So I really look at Kaneohe County as a really nice pilot project so that we can do this in other counties. And Kaneohe County is unique because you have ICE clients that come here, which is a whole nother unique ballgame when you're talking about the jail setting. So it's been a really great experience, and I think we are definitely figuring out and working through process through this first year. The other big piece I want to talk about is our community art wall project. If you've ever been to our Woodland Centers office here in Willmar, along our parking lot is a big, huge cement, ugly gray wall. And we were able to get some community dollars to be able to do a community art project. And our goal with this is that we know art is therapeutic. We know that people can be expressive through art, and it can be very beneficial for people that struggle with mental health and substance use. And we needed to paint this wall. So we brought together 3 events and asked our community and our partners to come paint with us. And it was a beautiful, beautiful couple of days. We had clients come and share their stories, sitting alongside our staff, sharing, Woodland Center saved my life. Let me tell you about how you guys saved my life. We had community partners coming and say, tell me about what you do, so we could educate people about our services and how we function in the community. And it was really successful. So if you drive by, you can see part of the mural. It's not quite done yet. Our goal for next year is we are going to bring this out to our other 6 counties. So each county will have a day, and we will bring those projects out and be able to have art in our other communities. It's been really great to be able to have that community project come together. Purchase of service contract. So for 2023, we did a 1% increase in our contract. For the first 6 months of 2022, 3,430 clients obtained services of which 66% were eligible for sliding fee, and that equated to 16,000 sliding fee services. Not every service that we offer sliding fee on is part of the POS contract. Only a small number of sliding fee services are in that purchase of service contract. So of those services that are eligible for the POS, about 30,800 services were delivered to 690 individuals. That applies directly to your purchase of service contract. So 69% were therapy and 15% were psychiatry, just in the first 6 months of 2022. So there's a lot of service happening. Again, for 2023, we're looking at a 1% increase for those contracts. And then we're eliminating the prepay for detox services. It's just historically always been in those contracts where we would average the last 5 years of bed days that each county would utilize, and we would have the counties prepay for those days. It's been a bit of a challenge just with refunding if somebody didn't use all their days, and so we're just going to kind of the same model we use for adult crisis and youth crisis. You use a day, you pay for a day. We're not going to prepay those days anymore. So that's really the big change for the contracts. And then I just wanted to give you a kind of another way to look at these contracts. If you look at the total cost for the contracts across our 7-county area, the cost per resident per year is $22.34 to ensure everybody across our 7-county has access to mental health and substance use services. So, what questions do you have for me?
Commissioners, any questions or comments at this point? Commissioner Emdek.
Thank you, sir. Dr. Chose, we have all experienced the maybe metamorphosis of meetings with a year of Zoom and then working our way back into personal meetings. And for everybody, it's a little different. And I agree with you, the hybrid meetings are the most difficult. But can you speak a little bit to the efficacy of using Zoom and electronic means of treating patients versus the in-person?
Yeah. I think what we have found is that for younger kids, in person is completely necessary. It's so hard to have a younger child over Zoom, especially if they already have ADHD, and you're like, okay, now sit in front of the screen for half an hour, don't move, right? I mean, that it's impossible, right? So for younger kids, it really is necessary to be face-to-face with the majority of those kids. Adults, it's a mixed bag. It really depends on that person and their preference and their ability to utilize the telehealth service. So we really take that client-centered approach. What is best for that client? Is it really working well for that individual? If it's not, how can we offer you in-person services? I will tell you that in-person is a little more challenging because our staff are wanting to work from home. So there's just that balance too. But as more clients have requested in-person services, our staff are drifting back into the office more as well because it's what the clients need. So I don't have any hard and fast data on it. I know a lot of places are researching that about what is the efficacy of mental health substance use services. Anecdotally, I can tell you our day treatment program has gone completely virtual for adults. And we started with 2 groups, and we now have 4, and we have a waiting list. So we are looking at a 5th, maybe a 6th group. And the beautiful thing about it is they were all in Candy-Ojai County, and now we are serving adults across our 7 counties because there's no restriction on transportation. So that's been huge. So it's really individual. Short and long of it, I guess. Yeah.
Well, and I think it is for us too. Some
Yeah.
of us like Zoom meetings more than others, and
Yep.
so.
Yep.
Commissioner Gardner first, please.
Thank you, Mr. Chair. Dr. Chose, just for the general public, folks who are listening in today, you alluded to this just a few minutes ago, but could you speak a little bit about the idea of social determinants of health and what that actually means?
Yeah, it's a nice buzzword we're using these days, right? Yeah, so the social determinants of health are really those factors that affect our well-being. And it's things like, do you have safe housing? Do you have food to eat, adequate food to eat, healthy food to eat? Are you living in a safe environment? Not only do you have housing, but is there violence occurring in the home? Is there drug use occurring in the home? Things like, do you have lead in your household? Do you have water, adequate water to drink? So it's all these factors that do you have good support system? All necessary things. And if these pieces are missing, it contributes to poor health outcomes. And so we need to ensure everybody has adequate access to these different pieces, because if we don't, they're going to have poor health, they're going to have poor mental health, poor, more substance use issues. Yeah.
And so when we see situations
Yes.
where there are these items lacking,
Yep.
where are we most typically seeing them, especially out here in our rural communities?
Yeah, say more about the question, because I think it's a broad range across our entire
Right.
Candioi County area.
So,
or Seven
so
County
different
area.
populations
Absolutely.
potentially, but not just populations, because we could talk about things like equity
Yes.
all we want.
Yep.
But if we're going to talk about equity, we also have to talk about equity between rural and urban. We have to talk about age equity and those
Absolutely.
types of things.
Absolutely. And I think even just affordable housing. The inflation rate has significantly increased the rental costs across our area. And we have vouchers for rentals, but not every rental place wants to take these vouchers. So now we have this disparity between people who are lower income and can't afford the rental units. So there is that piece. There are things as food deserts. So if you're living in a really, really rural area, you might not have access to fresh fruits, vegetables, and you're eating very processed food, which we know is not good for you. So there's a lot of factors in it, a lot of factors. And even thinking about just the income levels of people, right? That can be a huge barrier to people to accessing care and accessing what they need. I think the nice part about Candioi County is we have a lot of resources. And so if we are aware of what the needs are, we have an ability to help people access those resources because we have great partnerships in this county. Transportation is always up there, always on the list. Every time we talk rural Minnesota, transportation is just a huge barrier to accessing things. And then we go back to telehealth. Well, can we use telehealth to access some things? Some things, yeah, but not everything. So it's a multifaceted issue. And I think through our partnerships, we can really help navigate these pieces and help people access more service. It's not just one partner doing it on their own.
Thank you.
Yeah.
Commissioner Gardner, please proceed. Anderson, yes.
Thanks, Mr. Chair. I just had one, it was kind of a follow-up with Commissioner Imdek had to say. And so the initial visit is usually like a Zoom
Yes.
or telemedia or whatever. But later they have the option probably to be in person and.
Yeah, we
talk with
ask
you.
for
So you
preference.
can kind of cover that. And the first one's probably to put out the major fire and then the next ones are more to
Yep.
tune into what really is all going on.
What their
So,
needs are,
okay.
absolutely. And so we do have wait lists right now for therapy. We could probably hire 10 clinicians and keep them busy, and they are the hardest position for us to get right now, like everybody else. And so we do have a wait list. So we are getting people in for their comprehensive eval because that opens the door for everything mental health substance use services, including targeted case management at the county. So we don't want to hold that process up because we do have services where there are not wait lists, so we can get people in and get them rolling, even if they're waiting for therapy. And then once we know that there is a recommendation for therapy, we do ask, what's your preference? Male, female? Do you want to come in person? Do you want telehealth? And so we do try to accommodate those requests. And if somebody's kind of open, it makes it a little bit easier to get them in because it's, less preferences, sometimes just a little bit easier, but we try to really go with whatever preferences they have. Yeah.
Thank you.
Dr. Schultz, yes. I have a hard time pronouncing your name. Sorry about that.
That's okay.
Anyway, I'd like to point out that for the audience that we do have Commissioner Nissen on your board as well as Candioi County Health and Human Services Director Ms. Lippert. So
Yes.
it's so exciting to hear updates like this. Woodland Centers has had such a reputation over the years about what can we do better, how can we provide better services in the mental health area in the field, and it is expanding excellent. I'm very proud of what we have in our community. But like you said, there's still some barriers we have to deal with. But any further questions or comments? Commissioner
Yeah.
Imdek.
Thank you, Mr. Chair. So, Dr. Trost, you talked about the need for all the clinicians. What are the qualifications and the backgrounds necessary to become a clinician, and is that in itself a barrier?
Yes. So to become a licensed clinician, you need to have a master's degree or a doctorate degree in professional counseling field. And so the only doctorate program, PsyD program we had has closed. There is like PhD doctor programs, but they typically only take 4 to 6 students a year, and they're more research-based. So they're not pumping out as many clinicians as they used to. Most people are not going to school for this these days. Or else if you're talking the substance use realm, now we're talking an LADC, a licensed alcohol drug counselor, which is also moving to kind of that at least a bachelor's degree to a master's degree level. And then even after you have that degree, you have to then be supervised in your work for 2 years before you can practice independently. So once we get people on board, we have to have enough licensed clinicians to provide the supervision for those folks to then get licensed. So it takes a lot of our clinical time just providing that supervision so we can have enough people to practice. It's really challenging. And folks, I mean, if you go work for a big health system compared to a mental health center, you're going to get paid more. If you live in the metro, you're going to get paid more. So I think folks are more likely to be in the metro area. We've contracted with Novotel. It's a national company that provides telehealth. They have provided us with our 5 FTE for our same-day access. We are asking them for clinicians to do therapy, and they're striking out across the country. So this is not a Woodland Centers issue. It's not just a Minnesota issue. This is a national crisis that we're facing right now, just the shortage of mental health professionals.
Thank you.
Dr. Schultz, can you comment too on psychiatric services from the psychiatrist? That's
Yes.
even more difficult, I would guess.
Yes, it is. And for some, and I don't have any wood, but we've had some people applying. So we have more folks going into school to become nurse practitioners, which has been great, but it is still so challenging to find that nurse practitioner, psychiatrist level of provider. And I think right now we have about 5 FTE, and some of which, again, are that a Novotel company, national folks coming to us and doing telehealth services. It is, again, a huge national shortage for psychiatric providers across the board. It's really a struggle. Yeah.
Any further questions? Well, thank you very much, Dr. Schultz.
I did want to talk a little about our articles, if I could. Our articles of incorporation. I know you all received my membership invite, and so I wanted to just explain a few things on that and answer any questions related to that. So Woodland Centers has been around since 1958, and at the time we were established, our articles really said that every county who is a member of Woodland Centers or contributes, has a purchase of service contract, has a right to membership. And membership under our articles is every county commissioner from every one of our 7 counties. So we have 35 members, essentially. Membership in this, in our context of our current articles, really give members the ability to vote on our articles of incorporation and make changes to that. As you were probably aware, getting 35 commissioners together is a bit of a challenge. So if we had to change a word in our articles of incorporation, we should be getting our membership together and voting on those changes. In practice, because we were not totally aware that was the case, we have not been practicing that way. I can tell you that when we had Big Stone join us, that was my error. I did not realize that was the membership vote, and we, as a board, voted. So in practice, we have been more practicing what we are proposing to do, which is eliminate the membership and have all of the actions go back to our board of directors, which is comprised mostly of county commissioners, and so a social service director, and then 2 at-large members. It's really to help us with ease of our organization, and really putting all of that back on our board of directors, which is really how we've been practicing functioning, but really needing to put that into our documents, our legal documents.
Mr. Chair?
Commissioner Emdek.
Thank you. So I see that we are proposing to hold this meeting during, well, pretty much
Yes.
Counties all around are going to be having their board meeting.
Correct.
And I think that makes good sense because you have a captive audience.
That's right.
Logistically, do we have the technology for everybody to participate at that
I
point?
believe so. We had all these, I had conversations with every county administrator and our board members, and everybody felt like that would work to have it on the agenda at 10 and have the Zoom meeting. So that hopefully it works for everybody. We're going to do roll call and hopefully everybody's there. Yeah, it was strategic for sure. Yeah.
I'd just like to point out, it's my understanding that we do not have a joint powers agreement with you. And the
Correct.
county board is so used to dealing with joint powers with
Yes.
all the other
Yes.
organizations we deal with. But this is a different setup, and that's going to be realistic.
It is. So we look like a joint powers
Yes,
with this
and you act like-
membership and kind of how things look, but we are a private nonprofit entity. And so this is really trying to help us have that true nonprofit feel. The bylaws are not changing significantly. So it's really adding some language for us to get it up to date with the current law, but the bylaws are really who's our board members, how long do they serve in terms, and that is not changing. Every county will still have the ability to elect two folks to our board. So that doesn't change at all. It's really just helping to get this language up to date and eliminate the membership feel, because typically in a nonprofit, members are people that you are serving. So that would be a lot of people to be members of Woodland Centers. So even that from a nonprofit feel is not quite the same thing as a membership from a nonprofit. Most nonprofits do not have members unless you are an association or something along those lines. So.
Okay. Any further questions, comments? Anything else you'd like to share with us?
No, thank you so much for all of your support. Kaneohe County has just been a huge supporter of us, and we really appreciate it, so thank you.
That's good to hear, and a great update, very positive.
Thank you.
Thank you so
very much.
At this point, I would like to call on Kaneohe County Health and Human Services Director, Jenny Lippert. Good morning, Jenny.
Good morning, Mr. Chair and members of the board. You just heard from Dr. Chose and our local mental health center here, and I thought what a great way to give you all an update as to what we are seeing downstairs in Health and Human Services as it relates to our adult and children's mental health services. I have invited with me today our adult services supervisor, Corinne Torkelson, and also Constance Nelson, who is going to be taking over the children's mental health team. We are just in the midst of doing some transitions. This has historically been a joint team with the adult and children's mental health staff together under the direction of Corinne Torkelson. And now we are going to split that team up and move the children's mental health staff out under their own supervisor. We are seeing growth, and you'll hear that from the supervisor's report here shortly in terms of the challenges and the different areas that we are seeing increasing needs here locally. Again, the county provides involuntary and voluntary services for mental health. So we get individuals that are coming and seeking the support and need from our mental health social workers, but also we get, we're seen as a safety net for folks who come to us on a commitment status. And so I'm going to turn it over at this time to Corinne Torkelson, and she's going to give you an update as to what we are seeing here in our adult and children's world.
Good morning, Corinne.
Good morning.
Good morning.
Good morning.
Before you start, I want to just give you some kudos and just share with the board too, as part of the updates on the 18 County Mental Health Consortium, that you were just nominated and voted as vice chair for the northern tier of counties.
Yes.
So
Thank you.
congratulations on that.
Thank you.
And we got somebody really good representing us.
And as Ms. Lippert said, she wanted me to kind of do a state of affairs, and I decided that it's very hard. I don't have enough time to truly tell you everything that's going on downstairs. And so what I wanted to be able to do was to narrow in on some things that I thought would be good points to be made on as to some of the things that we're seeing right now as those current state of affairs. And some of those really playing off some of what Dr. Chose talked about what their services are, some of the limitations of those services, and how that has a direct effect on the work that we do for our clients as well. And if we just start with the adult mental health, we ended 2021 with a caseload size of 87. What that means is all of our cases that we had open, that was 87. Currently, we are at a caseload size of 97, which isn't a huge jump, but it's a jump. And particularly right now, because we are one full-time staff short, and having some difficulties in being able to fill that position. So we are seeing those challenges that come with more work, less staff, and creates obviously some limitations of what our staff are able to do and be able to want to do to provide for our consumers. And I'm going to narrow down a little bit from that area to narrow down to our commitment work. And commitment is that an area of non-voluntary. Majority of our case management is voluntary services. The client needs to be asking for that service. We start where that client is at. We develop case plans based on what that client wants to work on. Obviously, a commitment is something that's not voluntary. Just to do kind of a brief update about what a commitment is that we will get what's called a statement in support of commitment. Typically, those statements are coming from maybe the therapist, the mental health unit at Rice, the doctor, the primary care person. And those statements come to say that they believe that this person is in a situation in which they are a danger to self or others, and that they're making a statement saying, we believe this person should be committed. What we do with those commitments then is what we call a pre-petition screening. And what that means is that we're having contact with that consumer. We're having contact maybe with their family members, and with whoever is making that statement in support of commitment, maybe their other therapist or other support services, whoever may have some information that's beneficial for us to be able to sort through what is that level of danger to self and other, what is some of that history, what is currently happening. We really have to focus in commitment about what are the current status, what is just because they were committed 5 years ago may not create the need for that commitment now. So we really have to look at what that current status is. So that is all part of that pre-petition, and we're required to, depending upon if the person is on a hold, that's a 72-hour turnaround on that. If the person's in the community with the statement, then we have 5 days to be able to make a determination on filing that petition to the county attorney's office or not. Then what happens is that out of that pre-petition work is a decision is made as a team as to if there's enough to support a petition, enough information, enough concern, and enough risk that we're referring that over to the county attorney's office for the potential of a filing of a petition. Or it's a screen out, and that's the term we use of a screen out, that there isn't enough. And the reason there might not be enough is that the level of danger or level of risk doesn't raise to statutorial requirements, or the person may be able to say, you're right, I do need some help. And we're able to do some voluntary work with that person and be able to get them connected. Either that's with our service of case management or connected with other services as appropriate and as they're willing to work on. In 2020, typically, if you look through the last few years, we would average that 40 to 45 commitments, screenings that we did throughout the year. 2021 was a really high year for us. We had 62, we ended, of commitments, of screenings that we did on commitments. If you look at those numbers out of those. What I did is I looked at 2021 up to the middle of October, we had 52. Out of those, 44% were screen outs. So that means that out of that number, 44%, we were able to work with that person voluntarily, or it didn't meet that level of threshold to be able to support the petition to send to the county attorney's office. Looking at 2020 or 2022, from the beginning of the year to the middle of October, we are currently at 43 on screenings that we have done. But we have only had 9 screen outs out of that. So in comparison to 44 screen outs in '21, we only have had 20% of screen outs in 2021, or in 2022, excuse me.
Is it okay to interrupt you for
Yep, yes,
questions?
absolutely.
Okay,
Yeah,
Commissioner
we're
Imdahl.
talking about these screeners, and I think I'm understanding this, so using last year, maybe it was 2020, no, that would be last year, you had, I think you said 44% were screen outs. Does
Were
that mean,
considered screen outs.
that means that they did not end up getting committed?
Correct. That they did not even raise to the level of us sending information to the county attorney's office for a petition.
Okay.
Yeah.
So conversely, 56% of those that you screened did get committed.
Did get sent over for, not necessarily committed, got sent over for a request for petition. And then what happens in that is that then the county attorney's office reviews that and makes a determination as well as if they believe that it raises to the level of a petition being filed. And then if that petition is filed with the court, then obviously the court has that final determination as to if someone is committed or not. So there's different steps along the way to get you to the point of being committed.
And if I may follow up on that.
Yes, please follow up.
Then what percent of those do end up in commitment, or maybe it's not information that's even,
I didn't dig that deep, I'm sorry, for today's presentation. I sure can get that information for you, though.
thank you.
Corinne, may I add too, a screen out can actually mean that they're on a hold order someplace and they, at that point, agree to stay there as an inpatient and you look at.
Yes, from that voluntary
They're
standpoint.
still getting treatment. It just,
Absolutely.
it's not like they're just.
Yep,
well,
and
sorry.
when I talk voluntary, it's not necessarily just working voluntarily with us. They may be at hold at the hospital, and they're willing to stay voluntarily so the hold can expire and they don't need that commitment. Or they're able to reconnect with their current services, those sort of things. So there's a wide variety of what could potentially come out of those screen outs.
Thank you.
Commissioner
Are
Wilson.
those commitments coming from doctors and law enforcement, or are they coming from requests from family, or?
Yes, all of that.
Okay, all of the above.
Majority of our commitments, statements in support of commitment are coming from professional level of care.
All right, thank you.
And a lot of those statements are coming from Rice Hospital, for example, or from Center Care Hospital, in which they may be currently be on the mental health unit. On a hold, for example, law enforcement or medical hold has happened, and they're not able to adjust, and so they're making those statements in support of commitment, or they're not willing to stay voluntarily, and the risk is high enough. Yeah.
Thank you.
But a family member could also make a request for a pre-petition screening, and we have those on, and sometimes majority of those we look to support what's going to support that, and to raise to that level of a true danger to self and others.
Thanks.
May I just add, and correct me, if I'm wrong on this, it used to be that the Canandaigua County Board, or the county boards, were the mental health authority for the region in the area, or for that county, and we are still that responsibility, correct?
Absolutely. Yep. Yes.
For all these services we're talking
For
about.
all services, and there is a list of required services that the county needs to provide. And that really would probably be a really good topic for us to at some point to be able to talk about, because I think there's challenges to come in the future, maybe not so near, about what does it mean to be in the mental health authority, and what truly is required under that, because there is a list of services that we are required. The ability, that's why we contract with Woodland Centers, is to provide a lot of those services, day treatment, therapeutic services. It's a list of services that, as the mental health authority, we're required to do. And one of those things under that mental health authority is to look at the commitments.
Yes. Any further questions, comments? Excellent update. It's good to hear. I'm sorry, and not good to hear that you got so much more work to do. It used to be that, 2 to 3 commitments a month. It sounds like it was an average of 5 anyway, or more.
Right.
And is that related to the COVID, do you think? Or is it before that, too, the numbers have gone up?
I
It's
think we
hard.
could relate a lot of things to
To COVID.
COVID. I think
We'll
some
blame
of our
COVID for
increase
everything,
in
yes.
2021 was definitely some COVID-related. I don't know if I have more time or not. I just was
Well,
going to do a quick overview on the children, but
Okay.
we can do that another time.
No, we can do it. Please proceed.
Okay. And again, what I did is try to narrow down to a particular area on, for children's mental health, we are, provide targeted case management, and a child needs to meet a seriously emotionally disturbed diagnosis in order for us to be able to provide the services that we do. And we've seen a significant increase in cases in the last month and a half here. And so just to do a little bit of numbers for you. And so looking for September 1st to October 16th, so a month and a half. In 2019, we had 6 new case referrals. In 2020, we had 7. 2021, we had 6. And in the last month and a half, in 2022, we have had 15. And it's a significant jump. And what we are seeing in the kids, we are seeing younger requests for services, much younger than we've ever had. And we are also seeing children who are much more challenged in their mental health needs than we've seen before. And an example of that is we went for a good stretch where we had very few kids who are in what we call a residential 5 on residential placement, called a Rule 5, which is a step down from hospitalization, but a step up from like your therapeutic foster homes or your group homes, where it's really treatment. It's a treatment type facility that is meeting those day-to-day treatment needs. And we went for a stretch with having very limited children in a Rule 5. We currently have 5 with 1 on the wait list. And so we've done a substantial jump in the last 6 months of our children needing that level of care, which is concerning, obviously. And I think in the children's world as well in the adult world, what we're seeing is a lack of services. The lack of ability to get kids into services is really creating some of those difficulties. This one child in particular, we've probably been 7-8 months of trying to get that child into a residential placement and haven't been able to. Again, due to some needs of that child, due to the age of that child. And so there's lots of those challenges that are happening, and it's obviously concerning, particularly in the children's world, that we're seeing some of those things that are happening, and not only the stress and the frustration that has for those families, but also for those school systems and for the mental health services, and obviously for our case managers as well. So that, just to narrow down on that one.
Yeah, I have a question about placements then, and you brought that up, how difficult that is. I've heard comments that sometimes it takes up to 140 phone calls to find a placement. Is that correct? Is that not?
Yes. 140 might be a little high.
Right, okay. That could be
but-
child protection as well, but I heard this from other
Yes,
counties.
yes. And again, that, if you look just at children's placements across all areas, not just children's mental health, but also child protection that may need it, there are frequent phone calls that are being made in attempts to try to find appropriate placements. And we used to be able to be in a situation that trying to sort out what is the best placement for this child. Based on age, based on needs, based on the makeup of that facility or the makeup of the family, like a foster home. We don't have that luxury anymore. It is, we need a bed. Is truly some of what we are working on and dealing with on a regular basis. And that is across the board, not just for the children's mental health. And I would say in the adult mental health, an example of the step down. So maybe the person is committed, they end up in the hospital, and now we're trying to step them down to the next level of services. I have a worker who just gave me a list of 27 places she is called to try to get a bed for that person. And they're not, a couple things. Providers can be more picky now because they have because the need is so high, so they're able to be a little more picky about that. They're looking at that mix, but that what happens for us at the county level then, that you guys as commissioners need to know is that when they're not moving out of those state beds, they're costing us money, on big money. And so that it's that whole trickle down that creates problems.
I was just going to, you mentioned at the very last about the money aspect. What is, for the public, give us a number to place someone. It gets to be, I've heard horror stories about what it's costing on a daily basis.
As an average, if you're looking at a children's residential program, depending upon what level that program is, that's probably anywhere from your 180 to 285 a day, a daily rate, yeah. If you're talking adult, and you have someone in a state-operated facility, and they no longer meet that level of care, the hospital level of care, and once they determine they don't meet that level of care, we are paying anywhere from $1,700 to $2,500 a day based on what the level of care that they're in.
And would I be correct in saying those are county levy dollars we're using?
Yes,
for
those are county levy dollars.
Budget busters.
Children as well as adult.
Yep.
But yeah, definitely budget busting.
Good question you brought up.
Yeah.
I think you did an excellent job, and thank you for your presentation. And at this point then, Jenny, do you have anything else you want to add?
I'll just add one thing.
Please.
So, just to let all of you know, and also for those folks that might be watching, we do have our annual report posted on our county website. So if you want any of the data that Corinne kind of alluded to from last year, 2021 numbers, you can definitely head over to our Candido County website, and under the drop down of Health and Human Services, there will be a section and you can find our last year's annual report.
I just really like to add too that some of the concerns are coming up, that to hear more because we got this big issue that's not only Candido County but throughout the state of placements, and our clients that we serve, overlap with mental health, child protection, community corrections, and I've heard of counties can't find placements, and what are you going to do with some of these very difficult children to deal with? And I know one big county and a smaller county that actually the social worker had to keep the child in their office. And we don't want to go there. And there's a lack of resources. And I think counties are going to maybe have to start looking at, how do we proceed with this? Do we look regionally to provide some of these services locally as much as possible with other counties? But Corinne.
Just something along that line as
Sure.
well is that not only, the kids, when we do find placements for them, they're frequently not in our community.
Yeah.
And that the beds that we're able to find and the openings that we're able to find are, we placed one the other day at Blaine, which then makes it much more difficult to be able to support the family connections and reunification at whatever level that might be. So that just adds another layer to it.
And some of these placements are not only in our community, they're out of state as well, correct?
Yes.
Okay.
Yep.
Well, thank you.
Yep.
Thank you very much. And at this point, we're going to take a 5-minute break.
Yeah.
Call the Candidates County Board of Commissioners back in session. At this point, I'd like to call on Barbara Chafee, CEO, and would you please come forward and you have some updates for us? And welcome.
Welcome.
Good morning, Mr. Chair and members of the board and guests. My name is Barbara Chafee, and I'm the CEO for Central Minnesota Jobs and Training Services, serving 11 counties, including Candy Ohio County. My staff and I are honored to present to you today in person, Commissioner.
Yes, thank you.
For the first time in a long time because of COVID. It feels really good to just be in here and be normal, doesn't it? Even though we had a little glitch with the thing here. So, but just so you know, year 2022 actually marks our 38th year together as partners in workforce development, supporting members of Candy Ohio County looking for work and local businesses in need of qualified workers. Central Minnesota Jobs and Training Services serves youth, adults, dislocated workers, AMFIP, DWP clients, veterans, diverse populations, local businesses, and much, much more. Today, you will hear a client success story from Candy Ohio County and the impact and success of our great partnership together. So I am going to turn this to our next slide, see if I get it done correctly. Our agenda is really twofold. The first part is under federal law and state statute. I must bring you the annual fiscal audit. I must bring you the annual program performance report. And if there is any, the commercial insurances, if we have an update, my job is to bring that to you too. And also to provide you with the county demographics from that are Luke Greiner, and on the right-hand side of your package, you're going to find those two. And the reason that our Joint Powers Board and Board has asked us to bring this from Luke, and you're lucky you have him right here, which other counties don't, so you have access to him. He provides all this wonderful information just for you, so you can take it with you when you go to all of your other meetings and look really smart, because he's got great data for you, and it'll be at your fingertips. Also on the right-hand side of your packet is something that looks like this. This is a trifold, and this goes to, like our banks, they ask for this, the Department of Labor, et cetera, DEED. These are the data of the staff or the clients that we have served for this year, for this past year, sorry. Okay. The next here is that the most important part of this agenda really is not about me and the business. That's the boring part, but the exciting part is really what's happening right here in Candy Ohio County. And you're going to hear that from my staff. This is the 11 county commissioners that reside on our board. And instead of me telling you all about who is who and how many years they have served, I am going to pause right now, and I'm going to recognize Commissioner Steve Gardner for his outstanding leadership on the Joint Powers Board and his dedication and passion for service to Central Minnesota Jobs and Training Services and the citizens of Candy Ohio County. Commissioner Gardner has served on the Joint Powers Board for only 2 years, and he's already demonstrated his partnership, his leadership, and understanding of the complexities of workforce development. And so on behalf of my staff, on behalf of our board, and on behalf of our Joint Powers Board and our Workforce Development Board, I want to thank you, Commissioner, for being on the board and doing such a great job.
Thank you, and you're far too kind, but thank you and your staff for your leadership as well.
Thank you, appreciate that.
The board is always happy to hear things like this, and we have a good board, and thank you.
You do have a good board. I'm always feel really lucky when I come here because you're very accepting, and just to be able to come before you in person has been a joy today.
Great.
Okay, the next thing is, this is the map that there are actually 16 local workforce development areas in the state of Minnesota. I am the director over this 11 county area, and we're in that kind of a greenish, grayish I still can't figure out what that color is. But the blue is the metro area, so we actually wrap around the metro area northwest and southwest. So that whole area is that I am the director over. I just wanted to bring attention that we have many sites, and I'm going to, tell you what the sites are in this area. Hutchinson, we're at Ridgewater campus. Litchfield, we're located there. Wilmer, we're also here in this building. And we also have Wilmer, our staff are also co-located at Ridgewater College in Wilmer. And then we have Olivia, and our comprehensive center and our corporate office is located in Monticello. And that's where I drove from today. Next. I've already shown you this, so I'm just going to skip by. This is the commercial insurance, and I can tell you that I can't read it on there or there, but it is in the left-hand part of your packet. So it's called the Schedule of Insurances. That's why I always bring along paper, because sometimes you can see it and sometimes you can't. If you go at the very bottom, it'll say policy type, and it'll say cyber. The Joint Powers Board and the 11 counties requested that CMJTS increase their cyber security insurance to a $2 million package. And so I wanted to, this request from the Joint Powers Board and from the counties is important, it's appropriate, and it's timely. I don't know about you, but by the time I drive here and drive back, I'll have at least 15 of somebody who's attacking or hacking my computer. I think that you're noticing this. If you use a computer, even if you use your phone, there is a high percentage that you are already been hacked. And that's why it's important for us to have great, coverage. I'm going to take an example, is that who's ever doing this, some from across the seas, some from the United States, but they're getting smarter every day. You can receive something from me on your computer, a note from me on your computer, and it may not even be me, but it looks like me, but you have to know, exactly, what it's B. Chafee at CMJTS. So if it's not that, then you really take a good look at it, because you are getting hacked. They are very, very smart right now. So thank you for making sure that we got great coverage. Okay, that is that one. I'm going to just quickly tell you that this is my corporate and my executive team. And I'm going to go straight to the financials. Tricia is not here today. I normally let her do it, but today I'm going to do the financials myself and make it quick. December of each year, the Joint Powers Board reviews the annual fiscal audit with our fiscal auditors, Clifton, Larson, and Allen. So Commissioner Gardner will be doing that in February. I'm not going to go over all of the logistics here, because I know that you've been monitored and you know that what they do is they really dig deep. Clifton, Larson, Allen is a nationally recognized auditor, and so we're very fortunate to have them on board. The one thing I do want to point out here in blue is it says Review Internal Controls Manual. We have to keep this up every time there is a different law, every time there's a different statute. And so that is one of the things that we are also monitored on and reviewed. And they also want to make sure that just because we have this great controls manual, that we're actually using it. So that is the other thing that is really important for us. So rather than have me read 26 pages or 30 pages of the fiscal audit, I'm going to get really smart and just turn this over. So I give you page 22. And that's the summary of the auditor's result. And so you're going to see that there's kind of divided into three areas: the financial statements, and then the federal awards, and that's going to be our major programs. So I'll start and say that there was no material weaknesses identified, nor significant deficiencies identified under the financial statements, under the financial reporting. And there was no non-compliance materials to financial statements noted. Next is the federal awards. That's the major programs that they selected. There was no material weaknesses and no significant deficiencies were identified. And both of these are unmodified opinions, which is the highest opinion. The next is there is no audit findings disclosed that are required to be reported to you today, or the state, or the feds. So that always makes me breathe really well. And if you are a nonprofit and you have over $750,000 income, you must be audited. And so we had over 9 million this last year, a little less this year, lots of cuts on the federal level. So that's why we have to have a very strong auditor. And then the last, we always want this to be positive. So is the auditee qualified as a low-risk auditee? The answer, yes. So now I could take another great breath. Basically, we have 16 years of clean audits at CMJTS, which is extremely rare if you are a nonprofit. I know that many of you have already read the news about the nonprofit that, took lots of money to feed kids and didn't. So I've been informed by the Department of Employment and Economic Development that this year, all of the audits are even going to be harder. So looking forward to another audit, because I know that we're very clean and my staff do an outstanding job. So next, I'm going to hand this over to Leslie. She is my manager. She's going to introduce herself and what she does.
Good morning.
Good morning. Thank you,
morning.
everyone. Excited to be here in person as well. I oversee the Workforce Development Division, mostly our business services, and that's what I'm going to highlight today. So,
Mr. Chair,
Commissioner Emdek.
could you ask her to state her name for the public?
Oh, yes,
yes,
would you
And so that I can hear how she says it?
Leslie Witowicz.
Well, as everybody else who
Thank you
Yep,
very much.
nice,
Please do.
good
Yes.
Polish name, J silent, so,
It's not like Krzyzewski.
no. And I would not even want to try to attempt to spell that. So one of the things that we are really promoting right now and we're excited about because of the low unemployment rate, 1.7%, businesses are struggling. And so opportunity that we are able to offer them is incumbent worker training to help upskill and expand services through their current employees. It is a great opportunity. We're able to fund projects up to $25,000. And we just approved one for Unlimited Ag in Lake Lillian. So excited that we have a project going in Candy, Ojai County. They are going to train 4 of their employees to do CDL and expand their services. So again, as Barb had mentioned, we really want to focus on the success stories. So I'm going to make just highlighting one project per program. Dina Warnes is not here today, but if you do have any questions about our public assistance, adult dislocated worker programs, her information is in the packet and she would love to hear from you if you have questions and she would be able to answer them. What she wanted to highlight was the pre-release training program. Of course, we're trying to be innovative with our programming and writing grants, and this is to serve our incarcerated, soon to be released, to really get them some concrete skills so that when they're released, they can move right into employment. And dislocated workers are actually in short supply right now. Most everybody who wants to work is working. Diana Ristamaki is the youth program manager, and we do have her staff, Delina, who is going to share the success story. In your packets is the youth program chart of eligibility. As you can see, there are lots of different programs, and each program has different eligibility criteria. So the youth program staff have to be very knowledgeable when they're connecting with youth to see what program they fit into. This year, we were able to offer Operation Exploration Hands-On Camps. This is the flyer. We did have 2 camps that happened here in Wilmer at Ridgewater campus this past summer. Very exciting. I know Selena is going to share more about that. But I wanted to show, I'm hoping it works, technology, maybe not. No video. There is a video that we will send out to you so that you can watch it. It's a 1.5 minute long, but it shows a lot of pictures of all of the youth at camp. Oh,
There you go.
there's
There we
no-
are.
All right. The music isn't playing, but you can see the pictures. So we also had a camp that focused on the trades up in Pine County. We had a healthcare and trades camp in Monticello. And then we had the healthcare and trades camps here in Wilmer. And we had a lot of employers that stepped up to the plate and came and did the hands-on activities with the youth. They were able to really experience things hands-on and take things home with them that they created. But it's an opportunity for them to really try out a career before investing the money into college or schools. We were able to do a lot of employer tours as well, so local businesses invited the youth in. They really appreciated that, giving the opportunity to show their business, but then they also gave the kids swag, which they really appreciated. And if you have any questions as you're seeing the pictures, feel free to ask. LifeLink was a big hit with the youth too when that was able to come. And I think that's it. All right, I am going to let Delina come up and share more about herself and her success story.
Hi. Thank you
Good
for
morning.
having me here today. So my name is Delina Walcher. I work with the youth program serving Candia High and Renville County. And this past year has definitely been a busy one for us. So the career camp videos that you guys saw, really CMJTS held 6 innovative 2-week hands-on career exploration camps across our 11 counties. We named them Operation Exploration. The main goal of these camps was to offer a unique opportunity for youth to learn about exciting, high-demand, well-paying careers in their area. The focus on the camp was to provide in-demand career pathways such as healthcare, trades, automotive, manufacturing, agriculture, or other sectors in which labor market information indicates that there's a need for skilled workers. Really, we took a look at job openings of our local employers and tried to focus on those sectors. And essentially, the hands-on career camps, we had business presentations. So businesses would come in, provide information about what they do. They would talk about their job opportunities, the skills needed, the training needed, and then they would also provide a hands-on activity, as you could kind of see through the pictures as well. We took the youth on business tours, and some of the business tours would just be an overall, like, this is what our manufacturing area looks like. Or sometimes, like West Central Steel, they allowed us to come in, and the youth were allowed to do some welding in their shop as well. So that was pretty neat. They actually got to take home a souvenir, which they got to weld 2 plates of the state of Minnesota and weld it together. So it was pretty neat. We did some classroom instruction. We really focused on development of the career success skills. And then there was union training centers involved. We also had the Center of Excellence trailers, as well as Big Ideas come out to the camps as well. But more importantly, the opportunity to explore industry sectors through hands-on training such as manufacturing to weld, how to make the products. In automotive, working on engines, oil changes, tires, wiring components of the vehicle, and so forth. In construction, building walls, pouring cement, electrical rebar, operating heavy equipment, and truly gave youth the opportunity to try on those careers while they were making decisions about their future. So on the screen right now, you guys can see one of my youth. His name is Ket 2, and he wrote a success story for me that we have shared through some of our grants, and he also attended the camp, so you'll hear bits and pieces of that through the success story. So I'm just going to go ahead and read it. My name is Ket 2. I'm 16 years old, going to be a junior at Wilmer High School. I am Curran and currently reside in Wilmer, Minnesota. Prior to this, I came from a refugee camp in Thailand. I heard about CMJTS Youth Program through Ben Larson at the Minnesota U Inc., which is the garden that I partner with here in town. Since I wanted to work at the garden, I was asked to fill out CMJTS Youth Program application to help pay for the wages. After meeting with my youth employment specialist, Delina Welcher, I learned that there are so many more opportunities through the youth program than just working at the garden. So to talk a little bit about the garden, at the garden I helped with planting, pulling weeds, harvesting, cleaning, and preserving the produce that we grow and building projects. The produce is sold at the local farmers market, as well as picked for community-supported agriculture. They're CSA boxes is what they call them. We take turns completing different tasks so that way everyone can have a chance to learn the different jobs. Some of the youth have also learned how to fish and clean the fish for their togetherness meal, where we learn how to cook with the produce that we're harvesting. Then, of course, doing dishes throughout the day as well. During my work experience at the garden, I have learned to improve on my communication skills the most, which is a very useful skill to have. I have also learned to have more patience with things I'm dealing with, whether it is with situations or with people. My plan is to continue working part-time during school so I can save up for my needs. Outside of working at the garden, I also work part-time at Busy Bees Cleaning Company, which is cleaning commercial buildings. As for my education, I plan to take post-secondary education options, PSEO, classes to get my associate's degree along with my high school diploma. After accomplishing that goal, I would like to go to college for finance, business, marketing, and/or interior design. I would like to learn more about the artistic side of things and learn about business and finance. I was able to attend the healthcare career camp this past June that provided me with insight on many job opportunities in the healthcare field. We had presenters speak to us about their jobs and career paths and did a ton of hands-on activities with items they use on the job. We also got to job shadow at Bethesda and toured a physical therapy place. I thoroughly enjoyed the person that came to talk to us about Rice Care. This really sparked my interest at wanting to become a CNA. I think that would be a great job to have while I continue my education. So, thank you.
Any questions or comments? Good story, thank you.
I have.
Commissioner Anderson.
So my question would be, how do kids find out about, or people find out about Central Minnesota Jobs and Training? And is it through the school that you come into the schools, or is it just?
Yeah, so
you
that
have
is
to
definitely
search you out? I mean, how do they find out about you guys?
Yeah, that is definitely a very loaded question. I do a lot of outreach. My outreach is done through schools, but I also go, this group of students like Ket, I work with a big population from the Curran community. And they were referred to me by Ben Larson, who is part of the Menu Garden. And so he sends a lot of youth my way. So I partner with businesses, and then that leads to referrals as well, going to schools, talking to the counselors. We have gone into the Adulting 101 class, and that's where we really heavily promoted this career camp at Wilmer High School. However, for camp, I had students from Wilmer High School, I had some from Dream Academy, some from the ALC, some high school graduates. I had a few from Bold down in Olivia as well. And really attending those college fairs or the career fairs, the job fairs, and just the conversation. I do have a part-time job as well. I cut hair at Great Clips part-time. And as most of everybody knows, there's definitely a shortage in workers in almost all the fields across the board, right? So Great Clips experiences that as well. So whenever I have somebody in my chair, I always mention, I'm sorry, I only work here part-time because I do have a full-time job as well. And so then we start talking about those conversations and talking about what I do full-time, and that has led to enrollments as well. So really, it's, sharing with the community. We do a lot of outreach on social media as well. So if you guys don't follow CMJTS, definitely do that. We have the Facebook page available. We're on Instagram, Twitter, LinkedIn, and all those social media outlets as well. Did that kind of answer your
Yeah,
question?
it did. Yep.
Mr. Mdek, please.
Thank you, Mr. Chair. You mentioned Menu Gardens, and my wife and I just stopped out there last week. How do they find the youth? Because it takes quite a staff for them to run 2.5 acres that they turn a couple of times, plus the greenhouses.
Yeah. I know Ben Larson does a really good job at connecting with the local churches here in town. And the Curran community, they have a church that he has kind of filtered into. Otherwise, connecting with high schools is a big portion of it too. We work very closely with Jessica Johnson out at Wilmer High School. She's the work-based learning coordinator out there. And then also working with Vocational Rehabilitation Services, VRS, we partner with them, and that's how we get the kids to go out to the garden. This past summer, we actually had a special grant for my area called the Youth Support Service Grant, and that was primarily focused for the garden to help provide wages so that way we could get kids out there and working. And I believe I met my goal on that one. I think I had to get 12 kids enrolled in that, and I definitely had 12 kids enrolled in that.
So a lot of networking is what
Yeah.
I'm hearing.
Yeah, absolutely.
Okay, any further questions, comments? Well, thank you for the excellent update.
Yeah, thank you
Thank
guys
you.
for having us.
Thank you.
I'm not sure what
Oops.
else. we have before. So, thank you.
Thank you.
Can I have,
Well, thank you very much.
He's got a question.
I do have
Oh,
a quick
Commissioner
question,
Nissen.
and I'm looking at the trade schools in June, and I'm wondering about the timing of that. I'm thinking of young people that may be working in a laborer position and want to move their self up a little bit, and yet I look at the dates there and I'm thinking, well, they probably are working in some kind of labor or construction in the summer, and they probably can't make it to these. Have you ever thought of moving or having, and I realize Ridgewater is got school in the winter when they probably are drawing unemployment, but I thought, maybe something in the wintertime when they are not doing anything would be a stimulant to try to move themselves up the ladder a bit. Just a comment.
Yes, please.
That's a really good point. And most of the time, we are at the mercy of when they want it, when they're able to take kids in and do these things. So, yeah, I just happened to be up north when the kids were doing the heavy equipment. We also had the Band of Ojibwe up there too. It was just a remarkable time. So it's nice to be able to just go and see. I also have been at a lot of the events where the helicopter comes in, and boy, that is, everybody's out there to see the helicopter come in. It's just amazing. And they just beautifully park it right in front of the school. So, yeah, it's a good time.
Commissioner Gardner.
Thank you, Mr. Chair. Barb, I just want to thank you and your staff for the outstanding job that you do in serving folks who are looking at a change in career or beginning work or, any of those types of things. I don't want to put you personally on the spot here, so let me couch it this way. Would there be some concern on the part of the Joint Powers Board, for example, that there are some funding issues that might be, for example, perceived as being taken from rural to urban?
I think I know what you're talking about. As far as, there's a lot of grants that come, and they come from the department, the State Department, and Greater Minnesota sometimes doesn't get their, what I call fair share. But is that what you're talking about?
It is. Specifically, are we seeing a decrease in funding for example, CMJTS in favor of more urban initiatives? And in particular, how the competitive grant process is playing a role in that.
When we're looking at the competitive grants, yes, especially in the last couple of years. But there has been a lot of focus on the BIPOC population. What I think, when you're down in the metro area, you think that's where all BIPOC people live. But we have so many diverse populations out here in Greater Minnesota. You have you have a lot of great people that have come into this area that we also need good grants to help serve. And you can see that by what was presented today. As directors from the rural Minnesota, we get together and we talk about these things. But when we look at percentages, our percentages we're about 97% white. But, that might have been taken some time ago. And so now we have a diverse population, and I think we're getting stronger in that area because, and I think it's a good thing, especially when we don't have enough people to fill the jobs that are here, that just taking a look at BIPOC populations is a wonderful, strong, makes our community strong. So yes, would I like to have more money in Greater Minnesota to do that? Absolutely. So that's my answer.
Well, you bring up a great point in that our immigrant communities are highly industrious, highly entrepreneurial, and they are a strong asset to Willmar and the entire Candioi County, and in fact, the entire region. I do note that in the demographic information that you've given us, that we're seeing some issues with out-migration to different areas of the state. And one of the primary issues for us locally here is a lack of safe and affordable housing.
Yes.
And right now, we do seem to be having an issue with one specific entity that is not providing safe and adequate housing. And hopefully we'll see some resolution to that in the future, but that's going to take more work than what we can provide locally. And hopefully we can get some state involvement in that eventually.
I'm hearing that from other very rural areas, so you're not the only ones.
So thank you for being here.
Thank you very
today.
much.
Commissioner Emmett?
Yeah, I just have one,
They won't let you go.
yeah, I see we're knocking up against the next presenter, but 1985, there's some people in this room that are old enough to remember the early 80s of the farm crisis and the dislocated
Yes.
workers program.
I do remember.
And I personally took part in jobs and training and evaluation. Was this building here in 1985? No. Okay, so it was in another building, but it was in Kaneohe County, which led to me working the trades for a year while I figured out what my next move was. I ended up at St. Cloud State University, which ultimately led me to moving to Kaneohe County and being a part of this. So I can tell you that it made a difference for me because I didn't really know where to turn at that point. There was high inflation rates, low jobs availability, but for me, it worked out very well.
Thank you for that. I appreciate that story because, I have a story too. I actually was very poor when I went to college and got some assistance and ended up actually teaching college for 10 years before I became a CEO. And so I did that in Hutchinson, Minnesota. So thank you. We all have our stories, and we help people to make sure that, we even helped somebody while they were still in, I can't remember which country they were a soldier. This is a few years back. And we got permission from the state of Minnesota to put this young man who was coming home in maybe 3 to 4 months to start him in college. And he started actually online and started his classes. And when he got back, he finished his classes, and his first job, he was at $125,000. So we were very excited about that. And those are just one of the success stories. And whether you are an officer or whether you are, somebody that has served, in a war and is overseas, we've helped. So thank you. And send them our way.
Well,
Thank you.
I want to thank you so much on behalf of the board. An outstanding presentation. You even left us with a lot of information that's going to be very helpful, and we're going to, I'm sure, look over this as we meet with other groups as well and pass the message across. And thank you for all of you coming this far and giving us this excellent update. It's good to hear positive things like this in our community, so thank you very much. Administrator Kleindl.
Mr. Chair, for the public, all this information that was presented today is online, and there's a lot of good employment data. So I would encourage you, if you have employees or you want to be an employee, or just to look at that data. It's really good information.
Yes, thank you. Okay, thank you very much. At this point, I'm going to take a 5-minute break.
Another break.
The Board of Candido County Commissioners back in session. At this point, I'd like to call on Director Corey Smith.
Good morning, Mr. Chair, members of the board.
Morning.
My name is Corey Smith, Director at Glacial Lake Sewer and Water District. Today, I am before you to bring forward Resolution 2022-57, and that's for adopting the 2023 Glacial Lakes Water and Sewer Utility Rates, meter charges, usage fees, and assessments. Earlier this year, Eilers, they completed a rate study for the district. Their study called for incremental increases in the operating and capital budgets to ensure long-term health of the utility funds. During this process, they also factored into our various projects. One that they factored into is this Phase 2 project that we've been talking about and just started design. And I guess one thing I do want to note, kind of a side note on that, because there is no bonding bill this year, that could possibly push that project back because it is PFA funded, so they're not funding anything right now. But anyway, for 2023, they recommended to increase our capital fund by 3.5% and our operating fund, which is Fund 28, to the rates that are shown in Exhibit A. And basically, this year is just kind of a reset rate or reset year for our Fund 28. Moving forward, starting in 2024, they will increase by 6.25%. If you look at the 2023 budget summary page, it's the one with the blue header. On the top left, the top two lines, those are capital fund, Fund 29, that they come off of our fixed meter fees, which are base fees, and our special assessments that we collect. The next two are our O&M usage fees for water and for wastewater. Together, our annual budget comes up to be $4,126,572.64. The next sheet that I want to talk about is Exhibit A. Exhibit A lists out the charges for the meter base fees along with the usage fees for water and wastewater. Please note, you can see there's different sizes meters. Over 90% of our meters and our revenue comes from the 5/8 or 3/4 inch meter. We do not have any 6-inch meters at this time. So during this process, we've had multiple meetings with our budget committee, with Eilers, and with our Glacial Lakes Commission. So on September 26th, the Glacial Lakes Commission approved the budget and recommended forwarding it to the county board. With that, it is staff's recommendation to approve and adopt Resolution 2022-57 along with the rates as shown in Exhibit A.
Okay.
So moved, Mr. Chair.
Commissioner Emdak moves on the motion. Is
I will
there a
second.
A second by Commissioner Nissen. Any further discussion or comments? Commissioner Emdak.
Thank you, Mr. Chair. Corey, you mentioned the bonding bill that didn't get acted on at the legislature last spring because they didn't do a bonding bill.
Correct.
Recently, Engineer Odens and Commissioner Nissen and I were in Washington DC, and we talked a lot about infrastructure, and it was that visit had to do with transportation. And when we got back, we penned a letter that we submitted to the local papers, and I think the Lakes Area Review printed it about the impacts of not having a bonding bill, not having a transportation bill, not having a tax cut bill. And it's a plea to our new legislators, whoever they are, when they go back to session, to get this work done. It's really expensive. It's become expensive because now we've lost, 2 years potentially on this project? A year for sure.
Yeah,
And
it could be a year. Yeah.
and the costs are just going up as we wait on it. So again, if any of those candidates are listening, I hope they know that their failure to act has consequences.
For sure. Yep.
Any further questions or comments? Hearing none, I'll call for a motion on resolution number 2022-57. And I'll call for the vote. All in favor, say aye.
Aye.
Opposed, same sign. Pass unanimously. Thank you for bringing this forward.
Thanks, Corey.
Okay. Next, I'd like to call on Candioi County Zoning Administrator, Mr. Van Dyken. Good morning, Eric.
Good morning. Thank you, Mr. Chair and members of the board. Eric Van Dyken, County Zoning Administrator. I'm here with 2 action requests from the Planning Commission meeting of October 10th. And I'm going to go ahead and illustrate each of these, if I can, by aerial photo for some context for you. I'm going to try to place that in a...
I'll zoom in a little bit,
Okay.
Eric. Just tell me what you want.
First property here is this, actually it's 2 parcels right here. This is Highway 23 going north toward Spicer, just rounding the last curve. Elkhorn Lake is just off the picture over here. These properties historically have been used for some auto body use. You may recognize it with a white fence along the frontage there. The proposal at this point is from Jed and Callie Danielson, and they will be living there, proposing to operate a business out of their homesteaded property. And it would consist of, on Callie's part, some coaching and facilitating of, in particular, fast pitch softball. She has a history of that at the collegiate level herself. She has some current students and would like to do some of that with some pitching lanes inside the building. And then at some point on the, what would be the west side of the building here, hope to possibly put an exterior batting cage as well. And then Jed currently is involved in cycling quite a bit, works at a cycling shop, and would like to begin to offer a small store there where he can do some service work, maybe host some bike riding events, particularly related to the trail right next door, perhaps some rentals of e-bikes and things like that, and then perhaps some sales some days, hoping to slowly grow into that, but that's the nature of his proposal. The Planning Commission did unanimously recommend approval of that request with just one condition and the findings as you see in the minutes.
Mr. Chair, I would move on the recommendation of the Planning and Zoning Board on the, along with the findings and conditions.
Motion to approve by Commissioner Emdek and a
I'll
second by
second.
Commissioner Gardner. Any further questions or comments? I do have one question myself. The individual, there's a neighbor who asked some questions. Where is his place?
Just to the, if I slide that down a little bit, that's
Oh, wait,
his,
wait.
that's his name right there, Mr. Forcier.
Okay.
And he was mainly asking questions about whether or not they propose to do any much activity as it approached his property, and they're really hoping to focus their efforts down around here, so.
Okay. Any other questions or comments? Hearing none, I'll call for the vote. All in favor, say aye. Aye. Opposed, same sign. Thank you. Pass unanimously. Thank you. And next?
The second item here is, relates to a pretty familiar property, I'm sure, to you, but illustrated here in the aerial photography as the old Spicer Castle property. You may recall that a conditional use permit request had been received and previously granted by this board to develop this as a planned unit development. We'll have 11 units. Parallel to that conditional use permit process, then we need to actually plat that. And so before you today is a recommendation from the Planning Commission to approve the final plat, which is a bit of a formality at this point, but does then allow them to memorialize that development in that way, and then it gets recorded. So with that, the Planning Commission recommends unanimously approval of the final plat.
I will so move.
A motion by
I'll
Commissioner
second
Nissen
that.
and a second by Commissioner Anderson. Any further questions or comments?
Well, yeah, there's a
Commissioner
large area that isn't, there's that one large lot, is that intended for just to open spaces, or?
Maybe I can, I'm going to put if I can illustrate that here with what the plat looks like itself. We can maybe point to what you're referring to. So this is
Back it a little bit.
plat, just a little bit if you
Okay,
would.
hang on.
So
So,
that's,
Mr. Chair,
Commissioner Emdek.
This is the Spicer Castle.
Yeah, I know where it is.
Okay.
So this is the final layout, which is no change from the preliminary that the Planning Commission had approved. So here you see a clustering of these units as the plan unit development typically requires. Units 1 through 11. And then all that you see around it, by the nature of a planned unit development, is common open space, since they own that together, and there's some covenants and restrictions, et cetera, that are recorded along with this to say how that land can be used and managed.
Okay, I just, there's 4 toward the lake, there's 4 on one side, 4 on the other, then there's an open area in the middle. That's just going to be an open space, is what you're.
Oh, this, are you talking about this
Yeah,
right in here?
yeah.
There probably will be a pool, for a common pool is kind of what they're proposing in that middle area, but it does separate a little bit. The idea, we were trying to, a planned unit development requires clustering of the units. Well, usually we have a parcel, this is not much larger than what would be the minimum size. Usually have a parcel where it's a little easier to actually illustrate clustering up in a corner. It's a little hard to do clustering on a parcel this small. So we were still trying to embrace that idea of kind of separating and putting these units together in a cluster format. So that's what we ended up coming up with and the Planning Commission approved.
Yeah, that was my curiosity.
Commissioner Gardner.
Thank you, Mr. Chair. And Eric, just for folks who might be listening, a planned unit development essentially is a way to be able to responsibly increase use and density on a parcel that might otherwise not be able to support it, correct?
That is correct. So it's a bit of a flexible type of development. There's a little give and take in these types. So one of the stipulations that allows them to increase their density a little bit is they have a heightened setback from the lake. That's 25% greater, and it would have had to been 50% greater had we not come up with some give backs that they gave on vegetative management. So they're putting some additional buffer near the top of the steep bank, some things like that. So the give to the public is that the public gets some more green space and preservation and less impact on near shore areas. And the get for the developer then is more units to be able to market.
Thank you.
Any further questions or comments? Okay, hearing none, I'll call for the vote. All in favor, say aye.
Aye.
Opposed, same sign. Passed unanimously. Thank you very much for bringing this forward to us.
Thank you.
Much appreciated.
Thanks, Eric.
Okay, next on our agenda, we have Kennewick County Administrator Kleindahl's annual performance review, and I will present that at this point. Just to give you some background on this, Mr. Kleindahl will be retiring in a few months, approximately 4 months, and so the board is going to be doing a shorter version of his performance review, let's put it that way. But I really want to make a point that it's still very important review, and is important for the county, and also extremely important for Mr. Kleindahl. All the county commissioners received a form to fill out, and I collected all those from all the county commissioners and went over these with the vice chair, Commissioner Emdek. We met and discussed these, and then we met with Mr. Kleindahl. There was a couple questions. I'd just like to share with you some of the comments that were made by the commissioners, and I'll just go ahead and read them. And these are from 2 of the questions, what did we do as commissioners and administrator together and accomplish this year or are working on, as well as other comments. And I will proceed to read those. And again, these are just comments off a piece of paper, so they're not necessarily perfect sentences always. The first one is worked on broadband and many other items that are too many to list. Move forward on enhancing childcare funding and capacity. Appreciate the discussions in reference to our ARPA fund projects and to continue to build board and personal capacities. Great work on high-speed internet and moving it forward. Working on ARPA funds and broadband. There's a theme going here, I think. We have made good progress in broadband and used ARPA funds. Some of the other comments were Larry has been a great county servant. He will be missed. Larry did an excellent job working with AMC on the opiate settlement. And then there was a comment appreciative of Larry's leadership and support of the board as a group and as individuals. I will miss his advice and passion for the mission of the county. I believe Larry has done a fine job and he will be missed. And at the end of the review, there was a rating by all the commissioners, and we had 3 things we rated his performance, and it could be rated as did not meet expectations, met expectations, or exceeded expectations. And very much like this last review, I'd like to say that Mr. Kleindahl unanimously received exceeded expectations. So it's a very positive report, and we thank you for this leadership this past year and all the challenges we have. Commissioner Emdek and myself, we talked to you about your performance review, and at that time too, we had quite an extensive discussion about what challenges that we're having in these next 4 years, and what we have to accomplish and work together, and as well as the transition. So, thank you, and we're looking forward to that. Administrator Kleindahl, do you have any comments at this point?
No, I just want to say thank you to the department heads that make me look good. Without the department heads, I wouldn't be here and have a great review. I'm only as good as the team, and the department heads and their staff make this county. And of course, then the leadership of this board has been very good. Over my 16 years, the board has always been forward-thinking, making sure that they let the department heads do their job, making sure that the public is engaged, and making sure that we don't just do the same old stuff over and over. I think that's a credit to you and the department heads that we're always trying to be the best. So thank you. I came to Kennewick County in October. I started actually working on Halloween Day. I don't know if that was a sign of things to come over my 28 years in Kennewick County. This is not my goodbye speech, but I just want to say, in November 1, I became the administrator in 2006. So this time of year is kind of special to me. There's a lot of memories and a lot of things that go on. And I think even my first job in Clay County was around this time of year. So it's been a great ride, and I just hope that you continue to do your great work, allow the department heads to do their great job, and our staff take the leadership of our department heads and keep pushing forward.
Commissioners, any further questions or comments? Commissioner Gardner.
Thank you, Mr. Chair. I'll let it be said that I'm generally not a big fan of performance reviews. Sometimes they're limiting. So I appreciated the shorter version that we had this time around, because it really gets to the heart of the matter. And I want to be very clear about this. You can't do this job as administrator without a great deal of passion. And Larry has that and then some. And what I've really appreciated from you, Larry, is your support of us as board members, as individuals, and as a board. And even when we might clash on certain things, it's always respectful. And that's a leadership piece that is set at the top. That's an expectation from you onto our board and staff, and I would say vice versa. And I have always appreciated my time with you, even before I came on the board and had certain things that I needed to talk to you about. I was always able to ask my questions and get answers. And what was important to me was that sometimes I got answers to questions that I hadn't even thought of yet. That's not always the case when you work in a body like this. And so I just wanted to say, from my perspective, thank you for that passion and for that leadership.
Thank you.
Thank you. Any other comments from anybody at this point? Commissioner Mdek.
So being it is his last review, I would just want to also thank you, Larry, for doing what you said you would do from before I ever took the oath of a county commissioner. You said your job was to keep my butt out of jail and out of trouble. And you've done a great job of that. 10 years are.
Well, we still got 4 months to go. But okay.
Yeah, you've got to step it up now.
Yeah. Oh, very good comments. Anybody else? Otherwise,
Well, just
Commissioner
when I
Wilson,
was a chairman and vice chair, I appreciated Larry's guidance, and it was much appreciated, and I believe you will be missed.
Yes, there's no doubt about it. Yes. Okay. At this point, congratulations on a very good review, and as I've commented before, that you are not going to be a lame duck these last 4 months, and we appreciate your professionalism as we move forward through this transition, but also meeting these future challenges. So thank you, Mr. Kleindahl.
Thank you.
And now that'll end the performance review, and we'll be doing more of this probably on February 24th, sharing some more positive comments. I would like now to ask Mr. Kleindahl for any administrative updates.
I do. And the first thing I'd like to add, in February, I had Andy Thorson come and give an update regarding the heat pumps regarding the law enforcement center and health and human services. And at that time, he provided a background about the heat pumps and stuff. And it was, at that time, we were asking about going forward. We got permission to go forward, but to make sure we got all of our I's dotted and T's crossed, and I do keep you out of jail, I want to ask the board to have Andy present one more time about the heat pumps so everybody's aware about what they are, and then ask for the bid. So just to make sure, because it's such a big project, that we have everything crossed.
Yep. Mr. Thorson, please proceed.
Yeah, so a little background. I guess I wasn't prepared for the background story
Okay,
again,
sorry.
but your heat pumps in a building are basically like a furnace at home. They wear out over time. Law enforcement center, they're not as old, but they're wearing out faster because they operate 24/7. We've had catastrophic failures, replacements. It's just getting to be too much to keep repairing and replacing one by one. We had an engineer come in and they made the recommendation to do them all at once. A lot of schools that are about the same age as this building have gone through the same process where they change out every heat pump in the building. So yeah, I was before the board on February 15th, asking for authorization to hire Martin Mechanical out of Fargo. And they started that day on all the engineering, and they finally got it done. That's how complicated this project is. So I just got the word yesterday that they were ready. So I guess I'm before the board to ask authorization to advertise for bids for this project starting on October 25th. And that will run for 3 weeks. It will be online on the builders' outlets. And so it'll be pushed out to all regional businesses that are available to do this work.
I'd like to call on Administrator Kleindahl, please, for a clarification. Yes.
So it's, as you know, you guys budgeted for this in 21 and 22 and for 23. We've been talking about this for 3 years. So with the bids and stuff, you still have a final say once the bids come in to accept them or reject them or request to go out again. So this is, again, to make sure we go through the proper channels, because this is a big project. This is a major project.
So it'll be advertised for 3 weeks. We'll be doing a pre-bid walkthrough on November 11th or 7th. And then the bids are going to be due by 11 a.m. on the 15th of November. So we will open them at board. We'll get, last. But then we will come back and ask for authorization to let the bids on December 6th. Right now, the construction schedule is start as soon as they can get materials. That might be an issue with lead times on everything. We will pause in the summer just because a lot of the contractors do a lot of their work at schools in the summer. So by doing this pause for the summer, hopefully we can get more competitive quotes that way. This also, we won't have our air conditioners down in the summer either, so it's for staff benefit also. And then they'd start again September of '23 with absolute completion date of June 1st of 2024. So it's going to be a long
Process.
yeah, and there's going to be a lot of meetings. But I'll say this would be, once this is done, if and when I retire, I'll feel good about it. I mean, I'll feel that I left the county in a good space, or in a good spot.
Sure.
So yeah, so I'm basically just looking for authorization to go ahead and advertise for bids.
And we understand it, the board, Mr. Thorson, that we have authorized this before, and as part of the administrator updates, because the urgency that we move on this, and
Every
we could
week.
save money. Commissioner Emdek, I believe you had a question?
I'll wait for the motion.
Okay, I would entertain a motion at this point.
I'll move the
Motion by
recommendation of
Commissioner
staff to
Gardner.
advertise for bids.
I put it up for bids, and a second by
I'll second that.
Commissioner Emdek. Now I will ask for any questions or comments. Please proceed,
Thank you,
Commissioner
Mr.
Emdek.
Chair. Two questions. We're talking about just the health or the law enforcement center
This
And
building.
and
too.
this building.
Yeah,
Okay, both
yeah,
buildings.
Yeah.
And
You gotta figure a home furnace is good for, 20 years.
Yep.
At the most. These are much older than 20 years. And we've been replacing, last year I'm thinking we spent upwards of $70,000, $80,000 just on maintenance on these heat pumps.
I'm sure, because I just replaced the furnace last year. What is do you have an engineer's estimate?
Yeah, probably 1.8
For both buildings?
for both buildings.
Oh.
And actually, it is, the law enforcement center is actually going to be more. It'll be about 60%, 40%.
Okay, any further questions from the commissioners? Hearing none, I'll call for the vote. All in favor, say aye.
Aye.
Opposed, same sign. Pass unanimously. Thank you
Thank you,
for
gentlemen.
your hard work on this.
Thank you, Andy.
And your continued hard work on this, way it sounds. All right. Well, please proceed.
So as you know, we've been talking about the healthcare plans that we're going to be talking about. I know Raleigh and Corky are the alternate on the Prime West meetings, but we also have to make a decision before the end of the year about what we're going to do about our healthcare plans. It's a complicated situation in that, now with the ruling that's coming down in Prime West, that we have to have multiple healthcare plans in our county. So I think as a board, we now have to step back and look, what does that mean? How does that impact our citizens? How does it impact what we were counting on revenue? And so over the next several weeks, we're going to be having a lot of meetings to having the discussions. I believe Prime West is setting up a meeting with by Zoom for the commissioners, administrators, and human service directors to have a discussion about it. I believe we will also meet with other healthcare plan providers to see what they have. And so in 2017 and 2018, when we had agreed to join county-based purchasing, is based on certain information. Well, since that time, the information has changed, and so we really have to dig in and kind of think about where we want to go and what's the financial impact, what's the impact on our citizens when we provide the services, what's the impact on our staff. And the challenge is we have a short period of time to get this all done. And so so the full board knows that Raleigh and Corky will be having a lot of meetings in the next couple of weeks, and quite intense meetings. Hopefully we'll bring information back because of some of the confidentiality stuff they have under the procurement issues. There's things we can't always share until we get our contract signed. And so I want you to understand that we'll try to get as much information out to you as possible. because you will have to have information to make decisions. And
I'd like to add too, involved in those meetings will be Director Lippert as well as yourself.
correct,
And your expertise is very valuable.
yes. Is there any questions that you would want myself, Jenny, or Raleigh, or Corky to be thinking about as we talk to providers? If any directions that you would have that you want us to make sure we continue to ask? And if you think of something later on, because I know I probably cut you off guard here, email it to me, any questions you may have, or email any one of us. Questions that you would want us to ask the other providers, and all three providers. And if you think of stuff, you know, ask. Because we're trying to gather the data. We had a meeting the other day, and there's so much that we don't know yet. And that's why we basically want to do interviews with the providers. Any questions? Yes.
Thank you, Mr. Chair. Larry, I'm just wondering if, for the sake of keeping us out of trouble, if we shouldn't, if we have those questions, we shouldn't just route them to you, through you, specifically to, so that then you can disseminate that going forward.
Chairman Berg brought up a good suggestion. We may, once we get some information, we'll probably try to have a work session with the proper notices and stuff. But we'll try to do a work session again, and trying to pull you guys together is a challenge. But I think that's a good suggestion to just take one meeting that we can all put it out there and go through the mud.
That sounds like a good plan.
And I just like to comment on you trying to pull everybody together is a challenge. As Karen's pointed out, sometimes I think we're viewed that it's like trying to herd a bunch of cats. But we get there and we get it done, so.
So if you want to just send me the questions, and then again, once we gather the information, we will set up a work session, and the four of us or more will provide that feedback to you.
And I'm just kind of wonder myself, and maybe Shane could help. Questions, I don't think that'd be a open meeting law conflict. I would guess that we are just trying to get information for the board.
I just want to add one thing to that, because Jim Prisbilla, who is the CEO of Prime West, asked, and I provided all of the email addresses for everyone here, all the commissioners, as well as Jenny and Larry. So he will be contacting you with an invitation to attend their meeting on the 3rd of November.
And that will be all counties.
Yeah,
that are
all the counties that are, so it's going to be, they may have to rent the Civic Center in Alexandria too.
I think it's going to be also on Zoom.
Yes. So he will provide all that information. That's just the tip-off I'd give to you, is you'd be looking for that email, and that will give you a lot more details than what I can provide right now.
Okay, thank you.
Yeah.
Right.
And
Thank you. Commissioner Nissen, please proceed.
So we'll move on. Yesterday, I received a notice of retirement from Jay Cruna, IT Director, effective December 9th of this year. So would like, because it's the department heads, what we do with the department heads is we usually have two commissioners sit on the interview committee. And so to keep the process going, I don't know if you guys want to decide who you want the chair, vice chair, or who do you want? We'd like to keep this kind of moving.
Sure, and we do want to move that. Thank you for bringing that to our attention. Often it's the chair and the vice chair. As the chair, though, I'm open if somebody's really interested. I think it's give an opportunity for the full board to be involved in some of these hires like this as well. And this is one I would like to ask anybody who would want to be on that. And Commissioner Emdek, if you would, are you willing to serve on that? Okay. Sure. Anybody else wish to serve on a committee like that?
I would not, I don't feel like IT is my area of expertise.
Okay. Okay.
And so probably would not work out for me. But there may be others on the board that have some knowledge and that might be useful.
Okay. Mr.
Well, I sort of work in that realm, but I would certainly defer to the chair and vice chair.
Are you comfortable with that? Otherwise, I'm fine as well. I'm interested in electronics like that very much, but I certainly don't have your background. That's
So-
the only thing. But I'm,
So that might make more sense actually than myself because of the experience of, the interest and the experience.
Yeah, I
by both of
agree.
you.
oh, no, I think, well,
It's really about a personnel running a department,
Yeah.
more than the details of.
So is it?
Exactly, yeah.
operation.
And when will this decision be made?
Well, we have to advertise and stuff, and so if we get it out this week, probably takes a few days for the HR to go through the
When's this return?
job description, update it. Say we post it next week, post it 2 to 3 weeks, maybe just post it internally first, see if we get any candidates. And then try to have the interviews sometime in November.
okay. And his last date is the
12/9.
9.
12/9.
Okay,
I think we ought to have some expert,
okay.
it's not just.
Well, you're giving me far too much credit now.
Okay, Commissioner Gardner, Commissioner MDAC, I'm fine either way. If you would like to do that?
Let Mr. Gardner do it.
And just to point out that I do not have any relationships within this. If anybody from the firm that works with the county, certainly that is not me. It used to be before I sat on here, and then I turned responsibility for those accounts over to somebody else. So I have no interest in
It is not a conflict
in this
of interest.
outcome, and it is not a conflict of interest.
So at this point then, Commissioner Gardner and myself then will be on that committee.
Yep.
Thank you.
Just some informational stuff. This District 6 meeting is on the 28th in Benson. Starts at 8 a.m. at the golf course. Save the date for 11/30, November 30th. At 4 o'clock, I don't know where, and I don't know the details, but SWCD used to do an annual year-end luncheon in December. They're going to change that to a more, a social event presentation because they have a big turnover in staff and they want to have an opportunity to meet with you more informally. And so I just want you to put that date down, probably at 4 o'clock in the afternoon. And so after
Okay, the
that,
30th of November?
Yeah.
Mid-Minnesota Development has a meeting
it's a fifth
that evening,
Tuesday, so that they thought that would be,
the 5th Tuesday,
or Thursday, what is it?
Thursday, or it's,
a Wednesday.
well,
Wednesday,
maybe
it's
it's
Wednesday.
Wednesday.
The fifth.
It's a Wednesday, yeah.
Yeah. So, and then, next board meeting, we'll bring in the recycling, building, to you, hopefully for bids. It's going to, it's all dependent on the city's planning and zoning meeting on the 19th, to change the plat and the name, the new plat, or the addition is called Stadium View Edition. And so if they approve that, then it'll come to you guys next week.
And the good news is it sounds like we might have somebody bidding on it.
So got some people interested, yeah. That's all I have, Mr. Chair.
Okay, thank you.
Mr. Chair?
Commissioner.
Just sort of a PSA out there as well. I do know that the Planning Commission for the city has dealt with some quorum issues over the past year. And so if any citizen of the city of Willmar would be interested in serving on their Planning Commission, they should contact the mayor.
Okay.
Well, that would be a bummer, not to have the meeting because of,
It's happened a few times during the course of this year. I think it's been better as of recent.
Fingers
But I do
crossed.
also know they have a couple of openings coming up as well.
Okay.
Fingers are crossed. That's it.
Okay, thank you. Any appointments from the commissioners or anything else on the calendars, commissioners, that you wish to put on there? Hearing none, then we'll proceed with our commissioners' updates, and I'll start with Commissioner Gardner, please.
Thank you, Mr. Chair. I'm going to spend my time briefly this morning, and you'll hear this again at the district meeting as well, but I chair the Candy Ohio Renville Public Health Board, and as such, I'm a member of SHAC, which is the State Community Health Services Advisory Committee. And through that, I've ended up participating with a joint leadership team at the state level consisting of representatives from SHAC, APHA, and the Minnesota Department of Health. And this is kind of my first appeal to you for supporting that group in the work to realign the public health system in the state of Minnesota. The last realignment took place in about 1974, where we went from over 2,000 public health boards across the state to 51. It is a model that essentially has not been touched since then. And several years ago, SHAC and the Department of Health did a capacity study and revealed that there are local public health agencies that are not able to meet all of the basic performance standards under the existing model and existing funding. And so discussions began on how that system might be able to be strengthened, and system-wide changes were found to be needed. And this was before COVID, then COVID happened. And it was clear that there were weaknesses in the system that hampered the ability to be able to respond to community expectations in some cases. And it is believed now that it's time for the state of Minnesota and the Department of Health, working with APHA and SHAC, to focus on some systemic improvements. Now, there is some good news in that the state legislature last year responded and made some more direct funding available to local public health and some system-wide state improvements as well. Counties and local public health are at the table through this work group with Department of Health, using a third-party mediator to hold the meetings so that all three groups are at that table as equals. And they're working together to improve that state-local system, but this process will take time. And so what I would be asking you for as we move forward, and I know everybody's going to have their own particular subject areas that they are going to want AMC to delve into and to make priorities. But I would ask you not to forget about our public health system. It's a little easy to do that post-COVID, but we have an opportunity to remake that system. And so I'd ask for your support in making this one of our top legislative priorities coming up in the 2023 session. And other than that, I had a lot of meetings, and that's it.
Okay, good update. And why don't we talk about that, since I'm on the committee for the information. Good. Maybe you can attend that too, if you wished. Commissioner Nissen.
Well, okay, I had, of course, Thursday, the 6th of October, we had the Prime West meeting up in Alexandria, and certainly talked at length about the ruling of the judge that the county-based purchasing wasn't exactly, apparently, as concrete as our attorneys and Prime West thought it was. We disagree with that assessment, but they're still discussing whether or not to appeal it. I certainly think we should appeal that decision because it's throwing a lot of wrenches into the works as far as whether the new counties will even be able to participate or afford to participate. And of course, the Prime West folks are very anxious to keep us, and they're starting to put all kinds of numbers together to try and convince us that we can make it work. We'll have to see what that looks like. And like I said earlier, they are inviting us to their next meeting, which will be November 3rd. And you'll all be able to get up to speed on that. We had a CPT Personnel Committee meeting. We're talking about revising some of our personnel descriptions of job descriptions and so forth. We've had 2 meetings there. We're still working on it. I did not make the meeting with the Woodland Centers because my wife had a medical procedure and I had to be there for her. Monday was a busy day. We had the county health meeting with Larry and I and Corky. I'll let Corky maybe talk a little more about that particular meeting. We also had a Glacial Ridge Trail Scenic Byway meeting. Talked about we talked about how we could possibly and maybe I don't know, Mel's sitting right here, but we thought maybe a drone picture of the whole trail would be a really good idea. So I'll have to visit privately about that, but to put on our website. But otherwise, that's still continuing. Prairie Woods Environmental Learning Center had their annual meeting last night. I don't know if we had a quorum for any of it, but we met and discussed a lot of things. I've asked Gary Westby's son Ben to serve on the trustee committee. We elected him provisionally because we really are trying to figure out going forward what that trustee job really is, because during my tenure on Prairie Woods, I've only noticed 1 meeting a year on the trustee side, and it's kind of up in the air what that job really entails. So we're going to take a look at that, and I would really like to have Ben on the committee or one of his siblings, because his dad was a very, very strong proponent of Prairie Woods. And that's about it. Lots of things going on, several meetings involving the Prime West deal, and let's hope that we can figure out where we're going with that.
Okay. Thank you, Commissioner Nissen. Commissioner Anderson.
Okay, I just had a couple meetings, a couple were canceled, but one of the ones I mentioned last time was where the Head Start governing body got an interview with by the federal government, and I was part of that, and I was really nervous up before it. I actually had a few sleepless nights leading up to it because, like, well, what do I know? But because I'd just been on the board for UCAP 2 years, but we were interviewed. It was via Zoom. This Yolanda Upkins, she was a gal that came up from, I think, Florida, and she was touring the buildings, and I wasn't part of that, but she was very impressed by how UCAP and Head Start program is being run around here. And then there was another guy by the name of Ernest Johnson. He was the fiscal reviewer, so we were grilled pretty well about what we knew, and that the part of their responsibility for UCAP and this Head Start program is to inform us, and so we were being basically tested on what we knew. But I would just want to say thank you to Deb Brandt, who prepared us ahead of time. We met about a week before, and she said, well, these are the type of questions that will probably be asked, and so she prepped us so that, kind of keep things fresh in our mind, what they all do and what the program all consists of. And so and just to say this about Deb Brandt, she's very thorough. Last summer we did she gave us a tour of the building downtown, and she even showed us the basement. So that's how thorough she is. and she's an open book. You can ask her anything financially, and she has the numbers right off the top of her head usually. So that, I think it went well. We're still waiting to find out how all that process went with the Head Start program. And then the other meeting I went to was Central Community Transit, and that was last Friday in Litchfield, and there's a lot of stuff going on. We're still trying to deal with the problems with the shutdown and the pandemic. We have 8 buses that we were waiting for. We finally got one bus in, and we've been waiting on these buses since 2020. And then one of my questions was, well, what year is this bus? Are we getting a 2-year-old bus? And she said, no, it's a 2022. And basically how she thinks we ended up with it was that our specs met the specs of this bus that was built, and they just handed it to us. Well, not handed it to us, but it did cost money. But it's it only costs the CCT about $9,000. The rest is by federal grant money that pays for the rest of the bus. But we're still waiting for 7 more buses, and I think we got to order 3 more for next year. I think the average mileage right now on the buses is right around 200,000 plus. They've had to take some in to get some body work done because there's cross braces under the buses that are starting to rust out, and they got to get it supported and so that they're safe on the roads. And other issues like that, I guess one of the buses had where underneath the bus driver it was basically mush, and so they had to add more support under there. So it's nice that we aren't spending the money, but we're not able to, and it's starting to get a little critical. The other thing with the CCT is if we could get enough drivers, and they're short quite a few drivers, we would be back to pre-pandemic levels. But because they can't get enough bus drivers staffed, they're still down about 1,000 ridership. I think it's a month or whatever. So that's basically everything that I remember about that meeting. So that's all my report.
Commissioner Andiak.
Thank you. So on October 7th, I met at her request with the director of the SWCD. She was quizzing about annual meetings and saying how they used to do that, and did you guys enjoy it? And I reported that I thought it was good for us to meet with them once a year, especially they have a new director and we have a couple of new commissioners that probably haven't participated because of COVID, I think is the case. Yeah. So, and then we met, we had planning and zoning last Monday evening. By the way, last Sunday and Monday, Raleigh, my wife and I traveled a good share of the scenic byway, and it was very, very timely because the colors were beautiful. We had a community corrections meeting Tuesday of last week. We did on the 13th. I met with the chair for the administrator's evaluation. Friday, I was at the Association of Minnesota Counties Board of Directors meeting in St. Paul. And then last night, and Commissioner Nissen, thank you very much for standing in for me, taking the minutes at the Prairie Woods Environmental Learning Center. We had a very robust meeting at the Peace Church in New London regarding the Highway 23, Highway 9 intersection safety improvements. And I can report that that MnDOT there was 4 concepts that were being considered, lights, a J-turn, a roundabout, and an interchange, and the lights and I think it's safe to say the lights and the J-turn have been taken off the table. So moving forward, they put together a funding resource committee that will basically be not looking for funds necessarily, but to be answering questions about why these funds can't be used for this or where funds come from. So, yeah, that's what we've got going on. What I had going on, I will note that our colleague in Pope County, Gordy Wagner, who is the chair, was pictured in a ribbon cutting on that bridge over the railroad tracks on Highway 29. And he got to be the first guy to drive across that bridge yesterday, and which is a segue into October 25th when we have the ribbon cutting event here in southwest corner of Wilmer for the Wilmer Y. So And one last thing.
Oh, one quick question, Commissioner Emdek? Can I-
Okay, give me 1 second here.
Oh, sure.
Okay, that was it. It was covered.
I just
Oh, I
wanted to
didn't-
piggyback on what he said. He brought up the community corrections meeting, and that triggered something that last night at Prairie Woods, the building has been transformed, and with the help of the Sentence to Serve people, it looks really nice, and I will say that it came up, there was a thank you to the community corrections folks for that work, and it does look very nice. So,
Needed it.
yes.
Okay, sorry I interrupted you. Anything else you
Nope,
want
that
to
was
add?
it. Thank you.
Okay. Just a conversation today makes me think of, fairly often, a lot of people in our community don't know what county commissioners do. And I get asked the question, well, what do you do? Well, this kind of tells us what we do. And oh, well, gee, don't you go south anymore? No, it's at least a 30-hour-a-week job. Well, these last 2 weeks, I'm thinking it'd be nice if it was just a 40-hour-a-week job. We've all been really busy, and maybe it's what's happening right now in the fall. Things change too. I've been on several of the other committees as well. Spent a lot of time with the negotiation committee and working with the search firm and coming up with this contract. Prime West, I had a couple of meetings with that and further and additional discussions concerning that as well in Washington Zoom. I had another library meeting with some members of the law library. We had a Hot Creek project meeting, and they're kind of in limbo now, working with, we're starting to gain some momentum with the One Watershed project, since the administrator of the Hot project will be also the person working on the One Watershed plan. So it was a good meeting. We had the CCT meeting that Commissioner Anderson talked about, and I think being short on buses, they did buy one bus, that was a used one, and I forgot, but it had a lot of miles, but.
Paid $4,000 for it.
Yeah, $4,000 for it, but they do have them inspected well. So even though they're limping along, they're safe, so, yeah, so we're working good on that. Can we talk about the performance review, the community corrections meeting, and 18 county mental health annual meeting, and that's a consortium, and involving this other 18 counties that were part of the catchment area for the regional treatment center when it closed down. And as a part of that whole negotiation, way back years, the money that since they closed the regional treatment center, the state then funds through grants, mental health services in our 18 counties, and that was the catchment area of the Wilma Regional Treatment Center. And the outcome, I just want to give everybody a heads up that since it operates just off grant dollars, that they don't have like a cash reserve to speak of. And they're running into some issues now that because of a cash flow, Department of Human Services has been late in getting some of the grant dollars out. So there's a couple of plans they're looking at, and one plan is to talk to Prime West to see if they would just float them a loan just to cash flow the dollars for the grants, because if they don't do that, that means that some of the services wouldn't be provided, and or the providers that we contract with would have to fund that, and they're not in a position to fund that as well. So we're looking at the $270,000 to Prime West, and that board will be probably addressing that issue if they think that's appropriate. Otherwise, another option for the cash flow proposal was to bill the 18 counties for approximately $15,000 as a fund to be able to cash flow the dollars, and this would be more of a loan type of thing that after 1 year, because we need this year to kind of come up with another plan. But meantime, come the first of the year, we're going to be having an issue with that. So that may be coming before the board in the next few board meetings as well. So, otherwise,
When you're done, I have one thing.
Okay, well, actually, I covered quite a bit, so.
Just so you know, the folks at CCT, I happened to run into Don Williamson on Sunday at McMillan's and asked how things were going. And you would not believe the number of vehicles he is short and cannot get. I mean, he, like 14 or 15 of those Peterbilts and whatever he uses for the garbage trucks, they just aren't available. And so it's not just the buses, it's apparently everything is in short supply.
Yeah, it'll come, but it's going to take time, and I think we just have to be on top of that and look for ways to hire people and get people from other people if we have to, and as well as the shortage of supplies. So anything further for the board, Commissioner Endek?
I did think of one thing that I couldn't decipher in my hand scratching here earlier. But, so we have two members of the Planning and Zoning Board that will be terming out in December. One of them is from my district, so I'll have to find a replacement from my district. The other one, we're not sure if it's a member of your district or if she's a member at large. If she's a member at large, she can come from any district.
Okay.
If she's not a member at large, but is the appointee from your district, you'll be thinking about somebody. But I texted Eric, he can't remember if Jane Youngkrantz is a member at large or the regular member, so but just think about, and if you know somebody in Duane or my district that you think might do a good job on planning and zoning, let us know too.
Okay, thank you. Any further questions or comments from the board? Well, I hereby adjourn the Candido County Board of Commissioners. There we go.
So just so you know, the